how does a bone move? Unless your muscle is working, your bone cannot move even from here to here. Bone is just a supporting structure. But if the bone has to work, your muscles have to work and make it go to that point where you do jog, run. All of those things are aerobic exercise, which are there for losing calories. This exercise particularly is to make your ligaments stretch to the max, make your muscles stretch to the max, make them work in a perfect way and get that flexibility back. रोबोटिक सर्जरी लोग क्या समझते हैं, अगर रोबोट ने कुछ गलत काट लिया या कुछ गलत हो गया, ऐसी वाली बात नहीं होता है.
डॉक्टर ही तो यूज कर रहे हैं.
Yeah, because it's all in our control and we keep seeing it all the time, watching it all the time. And when we do that, we know exactly where it's going and we would have calculated all of those things. Exercise के अलावा medicines के ऊपर निर्भर मत होइए, because medicines are not going to cure you. But with lot of right kind of things, you can take some help from physiotherapists as well. In that regard they come into picture, but again there is a lot of misconception कि physiotherapist मुझे ठीक करके भेज देगा. High heels, wearing it just for occasions and not make it as a habit to do that every day, that's better, because our foot is not designed to be in that angle. So obviously it will take a brunt, but if you are giving it less trouble, your foot will keep you happy.
Today on Just Curious, if you have bones, this video is for you. If you have ever had a pain in the body, it could be a back issue, it could be shoulder, this video is definitely for you, because in our studio, I have the man who arguably has the highest number of qualifications amongst orthopedics. So it's one and only Dr. Naveen Kumar here in the studio. Doctor, truly an honor to have you on Just Curious.
Thank you.
Welcome, sir. How are you?
Great, thank you. Wonderful. It's an honor to come to your show over here, and hopefully we'll spend some productive time helping
Absolutely,
people.
sir. I think you have. I mean, your profession demands you to always meet people who are always in pain, who are looking for the right advice, or probably your theater is the operation theater. But today, you're talking theater is
In your theatre,
where you're
of
going
course.
to play today. Firstly, how are you, sir? Where are you coming from, and how was your day so far?
So today I started very early. So usually I get up at 4:30 and 5:30 my surgery start. 4 out of 7 days usually we do start early like this and finish off the surgeries in the morning and then go to the OPD clinics, all of those things. And then just the day winds up towards the evening. That's how it is.
So you start your surgeries by 5:30.
Usually 5 or 5:30 because so that we can get enough number of surgeries in a day. Sometimes I have got a whole day of surgeries where I start very early at 5 o'clock and 7-8 surgeries in a day. So it will be over usually, hopefully by 6-7, sometimes even later, depending on types of surgeries.
So after the surgery, you have your consultation.
Yeah, I mean, I have a couple of dedicated days for surgeries, but even other than that, we do have some days where there are some trauma emergencies come up. Like, for example, today morning, we had a child with a fracture of the elbow, so I had to rush and do that early in the morning. So this is usual life for an orthopedic surgeon. Nothing different from any other orthopedic surgeon.
Oh my God. How easily did you put that out? It's just a normal life. I mean, you're playing with emotions, literally. You're switching gears, suddenly you're in the OPD mode, and suddenly you're in the surgery mode, and there comes your real Naveen mode, wherein you're somebody's husband, you're a father.
Yeah.
I mean, how do you switch roles so, effortlessly, sir?
So I had seen a video once regarding how men are and women are, nothing about women or men, but it is about compartmentalization. For men, every compartment is different.
What is it?
In the sense, for example, family, one compartment, hospital, one compartment, patients, one compartment. Everything is a compartment for us. Car, one compartment. Everything is a compartment. For women, everything is connected to everything. They're all interlinked. So one thing leads to another, and the other thing leads to another. So women can multitask, but mere mortals like me can't do that. We can only do one thing at a time. So I try to focus on that one and finish off that task and then move on to the next thing. So if I'm in one room and seeing a patient and doing the consultation, the next moment I'm moving to the second room. The first room I may be seeing somebody who has had the surgery. They are very happy, they are joyful, they are coming back saying that, look doctor, I'm happy, I'm doing all the things now, I'm able to walk. Next room, when I step in, the very next second, I may be seeing somebody who is in huge amount of pain, or they may be having some real problems where I have to spend time with them. So, and it's all emotionally, these are all things where if I don't keep them separate, if I make them all mingle into one, it just can't work. At least for me, I can't work that way. So what I do is, when I go to that room, I am dedicated to that patient. Literally my 100% is there. My phones are switched off. Apart from hospital calls, nothing else gets picked up in the middle of the consultations, because they need my 100% at that particular point of time. So that's what I try to do. So it's not easy. It's sometimes it's easier said than done. There'll be calls coming from somewhere else, and hospital. There'll be something coming through, but we try to do it as much as possible. Calls from family, home, that will take the last seat. So because we can't help it, that's how it is.
That's the
Yeah.
occupational hazard, one
Yeah.
can say.
Yeah, when my child had an injury, so my wife had to call the desk and inform me, because otherwise I don't pick up the calls.
Oh.
Yeah.
I mean, you've been in the industry for 25 years
Yes.
now. I mean, going through your profile, when I saw the line which basically said you are one of the rather Karnataka's orthopedic who has the highest number of qualifications, which invokes a curiosity in me as to usually doctors after 1 or 2 degrees they stop, and then consultation and surgeries and hospital life and private clinics, that becomes their life. In your case, I think first 18 years of your life you've done one phase of your life as a doctor. Again, you I think came back to India 7 years
Yes.
now, and you've started the second innings. So firstly, why is that you kept on going after degree, and what are these specializations, sir?
Yes. So a few things we need to understand here. It's not like I was crazy about getting more number of letters in front of my name or nothing like that. It just happened. So some people are born genius, but I'm not. I'm one of those who works hard. I just try to get my things right, and I move towards a goal. So for genius people, it's a different thing. But I'm not. I just work towards a goal. Say, for example, from here we are planning to go to Hebbal.
Mm-hmm.
So to go to Hebbal, so when you put the GPS on, when the car is taking you, we take a missed turn, unfortunately, and then it turns you again. It directs you to the right, nudges you to the right direction, and then again you miss one more, and then again it nudges you. So that way, probably my life took different turns, and I had to go to different places, different ways of doing the things, and probably those landmarks, wherever those places were in between, they all became my qualifications, and eventually I reached that Hebbal. That's all it is.
Oh. So through the journey, if I go through your introduction, there are just alphabets after alphabets. MBBS, MS Ortho, FRCS Ortho in England, MCH Hip and Knee in UK, MSc Ortho in UK, DIP SICOT in Italy, FEBOT in Portugal, MRCGP in UK, and DIP FIFA SM in Switzerland, and FSM in
FSCM,
UK.
Yes.
So, I mean, this is just Greek and Latin to us, but I'm sure the medical world will definitely read this better and appreciate things better. But as a layman, what caught my attention was your specialization in arthroscopy, ligament reconstruction, and you're specialized in muscle, tendon, soft tissue surgery, stem cell therapy, cartilage regeneration, robotic hip and knee replacement surgery, and a lot more, I guess. Shoulder replacement surgery and pelvic acetabular
Pelvic acetabular surgery.
acetabular
So that's
surgery.
basically the hip, around the hip fracture surgeries. Yes.
I think I'll definitely dig deep into each category, but currently I think you have a clinic in HSR apart
Yes.
from you heading the sports and the injury department for Manipal Hospital,
Yes.
Sarjapur.
Correct.
What is the stem cell therapy? I think I would want to understand this to start with.
Yes. So stem cell therapy is quite a nascent kind of field which is growing massively. In all medical specialities, it is something which is new and coming up. So if I may talk just not about stem cell, but it is more of regenerative medicine. That's the bigger word we use for all of these things, where we can replace something with more natural things rather than with a plate and screw.
So what are these natural things, sir?
Yeah, so when we say natural things, it is about something which comes from your own blood, or something which comes from your own bone marrow, or something which can grow into your own cells. That is the kind of things which we talk about. So when we talk about stem cells, that is the newer things which we are using. Say for example, somebody has got a cartilage damage in the knee, and quite a large area. A young gentleman, 2025, had an injury and very bad cartilage damage. So if it's a small area, I can make it better by doing various ways of cartilage transferring technologies from somewhere else where there is no weight bearing. In the sense, unfortunately, we have got some areas in the knee where there is no weight bearing. In the sense, इफ़ आई may tell in Hindi as well, जहाँ पे वेट बेरिंग नहीं होता है, ऐसे जगहों पे कार्टिलेज निकाल के वहाँ से जहाँ पे चाहिए वहाँ पे ट्रांसफ़र कर सकते हैं. लेकिन अगर इफ़ यू हैव गॉट ए लार्ज एरिया वेयर यू कांट रियली fit that cartilage in the sense you don't have enough cartilage, तब क्या करना पड़ता है? Then we will have to get the cartilage regeneration done. In the sense, we will have to send it to the lab, we will have to grow it into millions of cells, and then they bring it back to us, and then we use that to resurface that whole of that area.
Any example? आप example दे सकते हैं कि
हाँ.
where is area which is possible, area which is not?
So काफ़ी जगहों पे नी कैप जो टकना जो बोलते हैं उसके पीछे, behind the knee cap, when we have got a area of cartilage loss, or even on the inner side of the knee when they have got a large area of cartilage loss where there is no possibility of that healing back because cartilage doesn't grow, unfortunately. In those circumstances, we do use this. This is one of the common things which we do. But unfortunately, yes, people don't have the awareness that ऐसा टेक्नोलॉजी इंडिया में भी अवेलेबल है. वी डू हैव दिस थिंग्स nowadays in India as well. It's not like कि इंडिया में नहीं है. There are some around 10 to 12 countries where it is all well established, but there are a lot of countries in the world. There are of course 180 countries or something like that जहाँ पे ये टेक्नोलॉजी अभी भी अवेलेबल भी नहीं है. But India is one of the countries where fortunately we have got this technique there. But the immediate question which I get is मेरे पापा या मम्मी, they are 60-year-old and they have got arthritis, can we do this? No, sorry. This is mainly for where the underlying bone is in a good condition, जहाँ पे हड्डी ठीक ठाक है and just the cartilage is worn out, उस चीज़ के लिए we can do the cartilage regeneration.
So bone should be right,
the underlying bone should be in a good condition, and it should be usually due to some kind of injury or trauma, not that something where worn out, मतलब उम्र के साथ जो wear out हो जाता है उनमें शायद ज़्यादा कुछ फर्क नहीं पड़ने वाला है.
So is there a age gap here, sir?
It's not about the age, but how the cartilage has been lost is the main question. Because see, we use the term physiological age. मतलब कई बार क्या होता है, we see people with who are actually in their 50s, but they look like they are in their 30s, and they have kept themselves well. They have done good amount of physical work, and they have kept their health in a good condition. So it depends on the physiological age and what kind of injury they had. So that is one category where we use the cartilage regeneration to give a new surface of the cartilage for the joints. It can be done for knees, ankles, lot of joints.
So knee, ankle.
Even we do it for the shoulders as well, elbows as well. So this kind of cartilage regeneration, निकलना तो नी से ही नहीं निकलना पड़ता है, because the cartilage which we get from has to be from the knee, because there fortunately God has given us some extra cartilage which we can use it for these kind of things. But yes, it can be used for various different joints. Wherever we have got cartilage loss, especially if it's a massive cartilage loss, then this comes as a God gift for us.
So body में सबसे ज़्यादा cartilage कहाँ होता है?
सबसे ज़्यादा नी में ही होता है, because knee is a big joint where we have got ज़्यादा ढकने वाला cartilage. It is there all around. तो fortunately God has given us some extra ले लो करके, तो उसको इस्तेमाल करते हैं. That's what it is.
So ये stem cell therapy जो है,
हाँ, this is one thing.
That is, how is it done again? Is it an injection or is it surgery?
Yeah, so this one first time जब करना होता है तो we just take a little chunk of cartilage by doing a camera and उसको भेज देते हैं. Once we get the cells coming through, that comes as a liquid. So then when we do that resurfacing, then we will have to actually resurface in the sense make a little cut and open that area, and usko cartilage ko wahan pe we have to put the layer of that one, that liquidy stuff alongside with that fibrin. Fibrin is something which is in our own blood actually, matlab usko chipkane ke liye to heal that back to the bone. That helps. So that forms the interlocking layer so that we can get a new cartilage lining there.
So ये जो treatment है,
जी.
this is used as an alternate to what? What like?
Alternate to, for example, previously we used to do something called microfracture. मतलब cartilage अगर चला गया है तो उसके लिए there was no great things which we had. So we used to just puncture there, make some holes in that, ताकि we are hoping that bone marrow अंदर से निकलेगा and it will form a new cartilage which was of inferior quality, not like the normal cartilage. So that's what we used to do. Or we used to do something where it's called OATS, a procedure where जहाँ पे दूसरे जगह से एक plug of cartilage निकाल के नए जगह पे डाल देना. So that kind of transferring the cartilage was one of the things which we used to do. Even today I do that for smaller areas of cartilage loss. मैं उसको इडली कहता हूँ because it literally the cartilage looks like an idli. So idli एक जगह से निकाल के दूसरे जगह डालना. That's what we do. So that kind of technologies are still there, but for massive loss of cartilage, there's no other things because people sometimes come with, say for example, ACL injury के साथ आते हैं. But जैसे आप, yes. But लेकिन unfortunately, not everybody will have only ACL tear. उसके साथ, if the injury is bad, they would have a meniscal tear. They would also have some cartilage loss as well. तो जिनमें it has caused multiple things, not just one ligament injury. उनमें obviously we need to do something like this.
So next thing I saw in the list was ये PRP.
Yeah, stem cell का और एक हिस्सा भी है before we come to PRP. So stem cell we do use it for one more thing called avascular necrosis of hip. A lot of people wouldn't have heard of this terminology unless they have had this problem themselves.
मतलब इसका मतलब क्या है सर?
Yes. So a lot of people will have hip problems like arthritis, which comes with the age. That's a different thing. But sometimes we come across people who are young, in their 20s or 30s, or even maybe in early 40s, with hip pain. So then when they say hip pain, lot of times क्या होता है, they will get an X-ray done and X-ray में ज़्यादा कुछ नहीं दिखेगा and they will get classed as नहीं कुछ muscle का pain है तुम चले जाओ. So that happens many times. But yeah, some of them would have actually the hip joint का involvement हो जाता है जहाँ पे the circulation for the ball and the socket. Hip is like a ball and a socket. तो उसका circulation जो है उल्टी दिशा में बहता है, उल्टी गंगा बहती है वहाँ पे. तो the circulation happens around the neck of the ball and then the blood goes backwards to the hip. So that's how normally the anatomy is. So वहाँ पर क्या है, in some people the blood doesn't flow backwards because of the increase in the pressure in the capsule around.
Okay.
So we used to see these cases as rare things in the past. जहाँ पे we used to see 3-4 cases in a month, in a year or something like that. But since COVID, we are seeing lot more of these cases. So
even in youngsters, post-COVID, it's a common thing.
Correct.
Do you have a number, like in a month, how many?
Now it is literally 3-4 per month. So it's literally, it was 3-4 per year. Now it's 3-4 per month.
Any observations as to what kind of people in what professions are having this, like sedentary, IT?
Yeah, this is not really related to profession. Of course, there is a category where, say for example, लोग जो जाके deep sea diving करते हैं, in those kind of very rare professions or rare hobbies, you see that. But ये जो अब बात कर रहा हूँ, this is mainly because of the circulation being lost because of use of steroids, or even some viral infections which includes the COVID. People in whom
vaccine.
Yes, people in whom it may not necessarily be the vaccine as well. I don't know, because honestly there are people who have just had COVID, they never had any of the steroids or anything. फिर भी उनको they had this kind of problem where they had after 1 year, 2 years, they had suddenly hip pain and they come to us, and when we do the MRI scan, we see that the bone is already dying there in the shell there. So although it was a rare condition, but now it is a lot more. Hopefully we are hoping that in the next 2-3 years, once the COVID wave and all the things are gone, those numbers will dwindle. But अभी तक तो dwindle नहीं हुआ है. अभी तक we are still seeing quite a few of these patients.
तो इसको कैसे handle करना है? मतलब if I have to stay away from it, like watch out.
Yeah, this is mainly प्रिवेंशन तो शायद नहीं है, बिकॉज दोज हु आर गेटिंग और वेरी स्मॉल नंबर्स एंड इट्स नॉट easy to predict who is going to get it. But the early identification and right kind of treatment is the key there. Because see, like I told you, ये जो बॉल होता है उसके अंदर हड्डी मर रहा है. हाँ, the cartilage is there, a shell is there, egg shell जैसा, उसके अंदर हड्डी जो है वो मरता जा रहा है. As the bone dies, its supportive structure वो चला जाता है. Then the ball will start becoming mushroom rather than being rounded. So once it becomes a mushroom, the ball and the socket will not be matching each other. So it will start rubbing in odd directions, जिसकी वजह से you will end up having arthritis. So this process from where it started with from grade 1 to grade 4, which is complete arthritis, जाने में 2 से 3 साल लगते हैं. But the problem is people find it hard to understand कि ये ऐसे भी कुछ हो सकता है करके. Even when we have identified it, when they are in the stage 2, they will be thinking कि अरे मुझे थोड़ा सा ही पेन है, ऐसे क्या बोल रहे हैं ये लोग. And it's not, and problem is, like Rashmi, you told me just ACL, yeah, and because ACL, you will find 100 people around in your friends circle or community somewhere or the other, जिनसे आप बातचीत कर सकते हो. You can get an idea, you can get an understanding कि क्या हुआ था, कैसे हुआ था, what exactly happened, क्या सर्जरी किया, उसके बाद क्या हुआ. You can get the whole one picture in nutshell, but at least you can get a gist of what to expect. Isme one, that kind of things are not easy because it's not easy for them to meet that many people, because there are not that many people who have got this one. ACL, I see myself around 40 to 45 per month. So there are a lot more bigger numbers when we talk about. But AVN, although I am one of the persons whom vascular necrosis jo bol raha hu, so I am one of the persons whom the secondary tertiary referrals come. Still my numbers are only 3 or 4 per month. So there are less numbers in terms of that. And these are the people who find it hard to comprehend ki kya ho raha hai. And many a times they will go for all sorts of things, all sorts of treatments, which in maybe massage, ye wo phala dimka. They keep doing all sorts of things. By the time they realize, unfortunately, many a times they would have gone from stage 2 to stage 3 or even stage 4. So when they have crossed that border, then वापस उनको लाना मुश्किल हो जाता है. इट्स वेरी डिफिकल्ट टू
इसमें ये है कि once you get a pain, it's not a magic like you can get a massage or something. Things won't reverse for sure. It will only aggravate and eventually cause non-reversible damage. So you're saying prevention is better than?
Absolutely. It's 1% fortunate people, it doesn't go further and it sort of halts. But majority of people, it increases over a period of months together. Over months to couple of years. So that's the kind of condition we are talking about. So if it reaches stage 4, tab kya? Because the problem is these people are still in their 20s or 30s. अगर if it is somebody who is 55, 60, चलो ठीक है यार, और 1-2 साल काट लो, जितने से काट सकते हो काट लो, उसके बाद पूरा आर्थराइटिस आपको तंग करने लगेगा, तो we'll go and do a replacement surgery. Not a big deal. Because somebody 55, 60, अगर मैंने replacement कर दिया तो वो उनके जिंदगी भर के लिए it will become a permanent treatment. But for somebody who is young, who is still in their 20s or 30s, अगर माना कि मैंने replacement कर भी दिया, तो that will last for 20 years, 25 years. So he will still be in his 40s or 50s. So again another surgery to help that one. Again another 10 years, another surgery. So in his lifetime he will end up having 3 or 4 surgeries, and each time it becomes bigger and bigger. So this is the issue when they come to us late, when it's already stage 4. तो जब स्टेज 1 स्टेज 2 में आइडेंटिफाई होता है, देन अगेन द वन विच वी टॉक्ड अबाउट अर्लियर, स्टेम सेल के बारे में जो डिस्कस कर रहे थे, दैट इज द वन विच हेल्प्स देम, बिकॉज वो करके बाय डूइंग द स्टेम सेल वी कैन एक्चुअली गेट द bone, the dying bone, we remove that, we scoop it out and put the new cells, stem cells. So that stem cell comes from their own bone marrow. पहले निकाला होता है and we would have sent it to the lab and they would have grown it and sent it back to us. And same way we inject it and with the jelly, of course it becomes jelly once it goes inside fibrin and that one. So that will be something which will create a new bone, because we inject 50 million plus of osteoblasts. So those are the ones which form the bone. तो एक बार वो हो गया तो then yes, of course it is a rehab period will be there, but by 4 to 6 months they can be back to their normal life once the new bone formation is there and the ball has maintained its shape.
Amazing. Thanks, doctor, for throwing some light on stem cell therapy and of course cartilage regeneration process.
Yes.
Now comes one of the most common issues people do come up with is ACL.
Correct.
And today, I think you specialize in PRP.
Correct. Yes.
So
Yeah.
PRP is one kind
Yeah.
of treatment which can help
Yeah.
some ACL conditions.
Correct.
I would like to understand the basics,
Absolutely.
foundation of what PRP is and who it is for.
Absolutely. A lot of people would have known PRP not because of people like me, but they would have known that because it's getting done for growing hair, it's getting done for facial improvement of the all the marks and things. So dermatologists have taken it a big way, and people would have known PRP already before even I mentioned that. Quite a few people know that, क्योंकि करा चुके होते, they would have got it done for other things.
So PRP
So,
matlab plasma rich,
it is
platelet rich plasma.
Yes, it's platelet rich plasma.
Hmm.
So in simple words, it is taking one's own blood, putting it in a machine, centrifuge. It separates all the different layers of that. So the plasma is lighter, so it comes up, and red blood cells are heavier, it goes down. White blood cells are less heavier, so it forms a layer, and then on top of that all the platelets sit in the lower part of the plasma. So these platelets, Joy, these are the ones which help in clotting as well. So the
Okay.
same platelets,
Hmm.
unme they are packets filled of growth factors. So when we use those parts, the platelet rich plasma, usko alag karke निकाल के, when we use that for patients, so then that can work as a healer. So this is a natural thing. This is a completely from your own blood. कोई chemical नहीं, कोई steroid नहीं, nothing else. So I keep telling my patients sometimes कि इससे ज़्यादा natural चीज़ आपको बाबा रामदेव भी नहीं दे पाएगा, because it's a natural thing from your own blood.
Right.
Because anything, even a plant extract, is something which is still a foreign thing for you. So just for the sake of making them feel lighter regarding that one, we talk about that. But the thing is, yeah, in terms of when we talk about PRP, platelet rich plasma, that is something which I started using that in 2011. Even I was thinking, what the hell, they're taking our own blood and putting it back, how can it work? But we started it for the tennis elbow. Tennis elbow is a common condition. People come to me, and a lot of people know about that. Sachin Tendulkar had that, so it became popular in India. Any man, if I go and tell him that Sachin Tendulkar had it, so they will say that, हाँ ठीक है, मुझे भी पता है. So that's the kind of thing. So for that kind of things, we do it as a treatment, and then we sort of expanded the indications for that, because one, the kind of ये कि we are not going to cause any harm anyway. The kind of confidence with that we started. And there is a lot of evidence to say that it works for shoulder का partial tears के लिए, for the shoulder deeper muscles, rotator cuff tears जो बोलते हैं partial tears है, तो उसके लिए काम करता है. And it is done for patellar tendinopathy, knee का. So there are few things which there are a lot of papers already, but there are certain things for which there is not much of evidence base yet. But I still consider that as a godsend, because see, to be honest, orthopedics में है क्या? हमारे पास we get 5% of fracture patients, trauma patients, 95% or cold orthopedics. Cold orthopedics का मतलब क्या है? Where they will have some chronic condition or chronic pain, or
They're living with that
one which has
condition.
been there for a while. So either it can be arthritis, it can be some ligament का stretch हो सकता है, या chronic strain injury हो सकता है, repetitive strain injury, all of those things. So when 95% of people are coming to us with these kind of, or back pain, all of those things. So what are we doing for treatment? So unfortunately, we have painkillers and painkillers. उसके अलावा orthopedics में unfortunately we don't have much of things. If we talk about rheumatoid medications, that's a different thing altogether. मतलब those which we use for people who have got rheumatoid arthritis or inflammatory arthritis kind of things, that's a different subset altogether. But for these 95% लोगों के लिए मैं करूँ क्या? Okay, some of them are okay. They are थोड़ा सा arthritis की वजह से आए हैं, especially if they are something like 55-60. चलो ठीक है, उनको एक ग्लूकोसामाइन, chondroitin sulfate जैसा कुछ natural चीज़ें पकड़ा देते, और some cartilage regeneration के लिए collagen supplement दे देंगे. उसके अलावा करूँ क्या? And sometimes people go and consider everything as uric acid related, and gout के लिए एक tablet दे देते. इसके अलावा unfortunately मेरे पास I am left with not huge amount of itinerary in my quiver. That's the problem. Because for if you take any other medical specialties for that matter, they will have lot of medications which they can give. Orthopedics में unfortunately we बेचारों के पास कुछ है ही नहीं. So what has happened is this will bring us to the training and teaching part as well. But yes, I'll touch upon now.
Sure.
Because the thing is, because lot of us what we do, we give painkillers in different forms and shapes and different companies. That's all what happens. And some muscle relaxant. So, but none of these are going to cure anything at all.
Right.
While you're taking that, you will feel better. Once you stop it, it's back to square
It's pain
one.
management, not a
Exactly,
cure. Okay.
exactly. And sometimes I get some of the prescriptions coming from Northeast. I shouldn't be saying that, but literally there will be 15, 20 medications written for orthopedic conditions. I was like, wow, this is great. I don't even know this many medications to write. So that kind of things are there where people write medications, but unfortunately we don't have medicines. And लोगों को एक आदत बन चुकी है कि डॉक्टर के पास जाएंगे तो दवाइयाँ देंगे. And that unfortunately that is the way it has been for eons, for last 100 years or 50 years or whatever. So people डॉक्टर के पास जाते हैं, दवाइयाँ लेंगे, आ जाएंगे, 4 दिन पुड़िया खाएंगे, ठीक हो जाएगा. That's the kind of impression with which people come for orthopedics as well. But unfortunately, we don't have that kind of medications. So then after 5 days, 7 days, they get a bit better and again back to square one. They go to doctor 2 and then doctor 3, doctor 4. Same things, they will be going round and round in circles.
Circling.
So this is the problem. So then there are a lot of things which exercises can help. Whether it is some kind of stretching exercise, some kind of strengthening exercise. We'll touch base upon that one later. But these kind of things do help. Apart from this, और क्या है हमारे पास? We can't take everybody to the surgical room for everything. So then what else can be done? So there, this particular thing what we are talking about,
PRP.
the PRP fits in neatly because उससे कोई नुकसान तो है नहीं. It's not going to cause any harm. Worst case it may fail. It's not going to cause any harm. So from that perspective, we have been doing that. We do it for mild to moderate arthritis of the knee. That helps quite a lot. Not for advanced arthritis, but mild to moderate arthritis, it can help. For ACL partial tears, we do that. Complete tears, if the ligament is like this, no injection can help you. It has to be a surgery, like what you said. But partial, exactly, like in your case. But partial tears, jo hote, there a PRP can actually help in healing that one. We have seen hundreds and hundreds of patients where after a month, the magic is by checking. When we check, patient can feel it and we can feel that cut wali thing. And then after a month, we go and check it, it's gone. So it helps for that. It helps for patellar tendinopathy. We do it for heel pains, for patellar plantar fasciitis kind of things. People come with Achilles tendinopathy, which is again heel pain. So for those kind of things we do. And for partial tears of some of the ligaments outside the knee joint as well, like MCL and LCL, those kind of things. But the criteria is if it is a partial tear where there is some amount of still continuity of the fibers, then an injection can help in stimulating the growth and heal that back. If it's a complete tear, these are not magical injections. They are not going to cure anything.
Got it. So once I have consulted, once I understand PRP, next comes the cost and the effectiveness and what the patient should do. Can you throw some light on that, sir?
Sure. So PRP, again, one more confusion people often have is how many injections. So there are a lot of surgeons who do it as a set of 3 or even 5. I don't believe in that. I just do one injection. Rarely in people in whom there is more than 50% improvement but not 100%. Then after a month I would have gone and done the second injection. Otherwise I don't do more than 2 usually. That's very unusual for me. If the injection has failed to work, then there's no point in doing second, third, 10th.
So by the first and second you assess it and then you know it
by
is...
then it should have healed. If it has not healed, then इसका मतलब यही निकलता है कि this is not the right treatment. हमें कुछ और करना पड़ेगा इसके लिए. That we have to understand, because the definition of idiocy is doing the same thing again and again and expecting a different result, isn't it? So that's the thing. So PRP cost wise, I think there is a bit of variation. It varies hugely between 6,000-7,000 to even 25,000-30,000 depending upon where we do, which hospital and all those things. But yes, I mean the average is around 8,000 to 10,000 is the common kind of this thing.
इसके लिए hospitalization की ज़रूरत है?
ज़रूरत नहीं है. So because it's just an injection, so it is something which can be done in the OPD. I usually don't use ultrasound help for that? Because sometimes we do need that. For example, if it is a hip joint which I'm injecting, I need the ultrasound guidance to make sure कि I'm going to the right place.
Correct.
But अगर नी में कर रहे हैं तो रोज़ कॉपी करता हूँ, रोज़ कैमरा डाल के वहीं पे जाता हूँ, तो there is no need for me to use an ultrasound to get to the same place.
So you know
blindly
it.
आंख बंद करके करूँगा तो भी वही जाता है, तो क्या है, तो that's the thing. Yes.
Thanks for helping us understand PRP. And इसके लिए भी एज लिमिट कुछ नहीं होता है ना, इट्स ओनली नीड बेस.
नहीं, but yeah, that's what I mean. For if it is done for arthritis के लिए, then it may need to be repeated once every year or something like that, because that will put a break for the cartilage degeneration from progressing further. So for that reason, that is kind of something which we repeat once a year. If it is for a ligament tear, or if it is for the Achilles tendinopathy or tennis elbow kind of things, one injection, if it heals, it heals. There is no need for repeatedly going for that.
So in your case, since you also are a muscle tendon soft tissue surgery expert, can we throw some light
Yes.
as to who needs this and what leads to this?
Yes. So I'll just have to go back to the kind of training part for that a bit, because see, from last 120, 130 years, doctors have been, orthopedic surgeons have been doing surgeries, even in India as well. So even up till late 90s, orthopedic surgeon मतलब हड्डियों को जोड़ने वाला डॉक्टर. हाँ, तो हड्डियों को जोड़ने वाला डॉक्टर मतलब प्लेट एंड स्क्रू डालता है, नहीं तो रॉड डालता है, कुछ ना कुछ करके हड्डियों को वापस जोड़ देता है. दिस इज़ व्हाट वाज द स्टैंडर्ड कॉन्सेप्ट. एंड जैसे लोग हमें देखते, हम भी वो मान के बैठ गए थे कि हाँ, लोग हमें ऐसे समझते हैं तो हम भी हड्डियों के डॉक्टर ही हैं. बट द फैक्ट इज, बोन्स आर नॉट एवरीथिंग. हाउ डज ए बोन मूव? अनलेस योर मसल इज वर्किंग, योर बोन कैन नॉट मूव इवन फ्रॉम हियर टू हियर. Bone is just a supporting structure. But if the bone has to work, your muscles have to work and make it go to that point. When I'm just doing this movement, there must be some 15 to 17 muscles which are doing this work just to make my finger.
It is pulling the...
Exactly. So all of those have to work in tandem to do that. So for me, the more fascinating thing is muscle compared to the bone. Bone is something which is although it's a live structure, but it's a static structure. But the muscles are something which are next level. Right. So now with all the advances which we have got, Rashmi, we can replace somebody's joint. We can replace a bone as well.
Wow.
But we can't replace a muscle. उस technology से शायद हम, I think we are 100 years away from that kind of technology where we can replace a muscle. So only thing is, I can make the muscle work in a different angle. I can bring it into different place. I can bring the tendons, तार जो होते हैं मसल का, उसको अलग जगह पे बिठा के I can make it work in a different way and give a different functionality to that. But muscles are hugely different kind of structures compared to bones. And same for the ligaments. Ligaments, if somebody had an ACL tear, for example, in 1970s and 80s, तब क्या करते थे? पूरा ऊपर से नीचे तक काट के, it used to be a huge surgery, and forget about the whether ACL healed or not healed. ये scar वगैरह से, by the time you get the movement back, hardly people would have got 90-100 degree movement. So at the age of 30, they would have lost further movements as well because of the stiffness, scarring and all those things. So now with all the technological advances, we are doing lots and lots of ligament surgeries. When I was doing my PG in 2001, the ACL surgeries were rarity. So I used to stand in the back of the things and see one professor in Bangalore used to do that. Nobody else used to know how to do it. So, and that too once a year or something. So it was like that kind of rare thing. Now we do 2-3 every day pretty much. So the kind of, I mean, it's not like the problem was not there before and it started now. Previously it was not getting identified. लोगों को पता नहीं रहता था. हाँ, ये चला जाएगा, थोड़ा सा दर्द हो रहा है, मैनेज कर लूँगा, 4 दिन चलने के बाद कम हो जाएगा, थोड़ा सा मल लूँगा इसको. So people used to sort of just manage it.
Coping mechanism.
Yeah, rather than, and then eventually after 50-55 arthritis हो जाता था, then that is a different kind of era altogether. So now, if we talk about muscles, ligaments, soft tissues, all of these things are equally important things as much as the bone. That concept, even now when the training part is there, unfortunately that's not still in the books or in the way it is being taught. So abhi bhi, so lot of teaching goes on into bones. But when it comes to cartilage is a smooth lining of the joint, or muscles or soft tissues or even ligaments. There is much lesser kind of. That's why as I'm doing fellowship, I'm getting people who want to come and learn arthroscopy. So for them, yes, that respect to these structures is what we are mainly trying to make them understand.
समझ आ गया. So with this foundation, ये common man के understanding में, how does this affect their day to day movement? I mean, उसका problems अगर है तो कैसे पता चल जाता है?
हाँ, so देखिए ये दो किस्म की चीज़ें बात कर रहे हैं यहाँ पे. One is about the injuries, जहाँ पे they would have had a ligament injury or something, that kind of thing they are talking about. And second is we are talking about the kind of repetitive strain, मतलब the wear and tear की वजह से जो हुआ होता है. So these two are two different set of things. When it is trauma related, that is one of the things which is the another bane of my life, because लोगों को क्या लगता है कि फ्रैक्चर एक्सरे कराया हमने, एक्सरे में सब कुछ ठीक है, तो फ्रैक्चर नहीं है. हाँ ठीक है भाई, आई एग्री विद दैट, बट व्हाट अबाउट द मसल्स, व्हाट अबाउट द लिगामेंट्स का कुछ हुआ है क्या? So lot of times that attention will not be there. So it's not uncommon for me to see an ACL tear patient 3 months down the line when मैं आराम से चल फिर तो पा रहा हूँ, but whenever I have to twist or turn, I'm not feeling that confidence. So that happens. Ankle ligaments, lot of them come late because of the same things. Yeah, so these kind of ligament injuries don't get identified because people are not aware of that this could be there as well. And even if you identify them in the beginning, for example ankle, उसके लिए एक पट्टा देके मैं उसको ठीक कर सकता हूँ. I don't need to do a surgery for them. But वही चीज़, if they come to me after 6 months when the ligaments have not healed at all, then the story is different. We have to do something bigger. So
हम जितना छोड़ेंगे उतना बड़ा प्रॉब्लम बढ़ता ही जाएगा.
Yeah, so it's better to get that early identification of that. हर चीज़ के लिए हमारे स्कैन कराने की जरूरत नहीं पड़ता है, but at least to understand what is there and what is the right kind of treatment in the beginning, that is important. This is for trauma related, injury related things. And the other group is what we are talking about is that will take us to whole of sports injuries and everything, sports related things and all those things, where people come to me every day with runner's knee, patella tendinopathy जो कहते हैं, runner's knee जो कहते हैं, knee pain and things. That's another huge group of people whom I see, where that is mainly because of wear and tear related things. Wear and tear मतलब this is not उम्र के साथ होने वाला आर्थराइटिस का नहीं है. This is because of our lifestyle kind of things what we have adopted. So huge number of people who come to me with they start off with the problem is because I mean now we were not a sporting nation, to be honest. We अभी बन रहे हैं, we are becoming Olympics में, we are going up, तरक्की कर रहे हैं, we are doing it all now, but we were not there before. So if you take a generation back, मेरे पापा के generation के लोग, if you talk about them, they used to go to office और दफ्तर जाते थे, मेरे पापा स्कूल जाते थे, पढ़ाते थे, वापस आते थे. They used to just do that bit and they used to use cycle or something. So their health was sort of okay, they were managing. So then came our generation where a lot of our colleagues have become now techies or something else, and lot of people are now in sedentary jobs, sitting jobs. So those sitting jobs obviously made their back stiff, their knees stiff, their shoulders are not freely moving. All of those things have become stiff. So 10-15 साल दबा के after doing all the बैठ के press करके on the keyboards. After that now they have got the kind of sudden kind of eureka moment, नहीं मुझे अब करना है कुछ, or they would have gotten diagnosed to be having something like for example diabetes हो या BP हो, then suddenly the eureka moment comes, now I have to look after my health. मैंने बहुत कुछ कमा लिया, but now I have to like, nothing wrong with this either, that is something which has to be done, no age is wrong for that. But when they suddenly go, then in places like Bangalore you have got hundreds and thousands of options to do. You can go and start doing gym activities, you can go and do all sorts of sports. Your sports are there, they're all available. There's a rugby team now in Bangalore, because 20 years ago if I had talked about rugby क्या होता है पूछते थे लोग. So there are trampoline things. Honestly I didn't know what is trampoline. When I went to UK I didn't know what is trampoline, कभी दिखा ही नहीं था. So then when a patient came and said that I was doing trampoline and I got this injury, I was like, what the hell is she saying? मुझे लग रहा था कि trampoline must be some instrument, some musical instrument. So that's the kind of place where we were some 25 years ago.
Right.
Now there are so many trampoline parks in Bangalore.
True.
People are doing lots of martial arts. different kinds of martial arts, parkour, the Pilates and all those things are there. Next gen calisthenics are there. So Tai Chi, huge number of things. So mind-boggling number of things. So and then the one who advertises the most, they will go with that. Obviously, yes. And the problem is not that they are going and choosing something. The problem is that their bodies are not ready for that yet. And after a long time, suddenly, if somebody has been sedentary and then suddenly they take up running and start doing the things like trying to run a half marathon or whatever, their knees will not be ready for that. It's not about weakness. लोग कई बार assume कर लेते हैं कि हाँ मेरा हड्डियाँ weak है. नहीं, this is not bone weakness or muscle weakness भी नहीं है. Or my muscles are very weak, doctor. That's not muscle weakness. It's about lack of flexibility. Man, you have not done the things for last 10 years, 15 years. कुछ हिलाया नहीं है आपने, मुँह ही नहीं किया है, उंगली के अलावा कुछ और नहीं किया आपने. And now suddenly if you are trying to do things which your knees are not ready or shoulders are not ready, then obviously the kneecap for example will not glide smoothly up and down जैसे होना चाहिए. तो because of that the stress injuries हो जाते हैं. And once they get that, they will go 2 steps backwards and take the retro thing. All of those things happen. So for these things, it is something where if proper, and again this is not just the people side, it's also the training of these trainers, the people who are running these places, because there are a lot of new places. They recruit people who थोड़ा हट्टा कट्टा दिख रहे हैं तो उनको लगा लेते हैं काम पे.
They don't see the merit, they just see the exterior and then
yes, for them I am able to do this. ट्रेनर को ये बंदा क्यों नहीं कर पा रहा है. They wouldn't be able to correlate from where they stand and where these people are starting their journey to reach there. They can become better than them in the end, that's a different thing. But where they are starting their journey, so that warm-ups, cool-downs के लिए importance नहीं दिया जाता है, and the kind of gradual escalation नहीं होता है. अचानक they will try to do top-notch things from where they started off, or every day doing the same kind of things. Because see, even if you look at Western countries, wherever there is all this professional training is being given for athletes or any sports people to go and play at Olympics or that kind of things, they all don't play 7 days a week. Say for example, a swimmer will not swim 7 days a week. A runner will not run 7 days a week. But a lot of people don't understand that, and they will try to do it every day, 5 hours, 6 hours. They think that they will get better and better by doing it every single day. So if you are doing same activity, making the same muscle work thousands of times every day after day, you're not giving time for that muscle to relax, rest and heal self. So if that is not given, then obviously आपको injuries will start causing bother. And then that will obviously be something which they invariably get. One funny story, because 30-year-old, 35-year-olds, they go to orthopedic surgeons, and lot of us even today are very much into, like I told, bone and joint mode. So when X-ray is done, X-ray ka report mein radiologist will invariably write ki some degenerative changes seen, mild osteoarthritis. Then the whole world will come down for them. They will think that कि मेरा ज़िंदगी ख़त्म हो चुका है, I am already getting arthritis in my joints, बाकी joints में कब चालू हो जाएगा, what will I do, and all of those things will start creeping up into their mind. So this is a very common thing which we see, where people get so scared that they will stop walking. They will go to from one end of the spectrum where they have done lot of activities last month. Now because they are being told that mild osteoarthritis करके एक word इस्तेमाल किया गया है, they have come to this end of the spectrum where they don't do anything. Again, they have not gone back to where they started off. They have gone one step backwards. This happens in lot of people. So one thing we need to understand, I mean, of course, radiologists will write based on the findings they have to write, they are writing that. But one thing which orthopedic surgeons have to understand, people have to understand, is that this is something which is a progressive condition. Our knees will get worn out a bit as we grow. When we were in our 20s to 30s, अगर हमने X-ray कराया, तो for all of us, not like only one person, all of us, there will be subtle changes will be there. 40s को थोड़ा और changes, 50 को. So it's a kind of natural process for all of us.
It's body.
उसको, yes, by giving a brand that it is arthritis, that will completely threw them off to completely in a different way.
Mentally,
So,
it'll pull you down.
yeah, unnecessarily they will start thinking there will be huge amount of psychological baggage they carry with that one. That is something which I didn't understand. UK में I didn't see that much of psychological that kind of baggage. Probably because everything मुफ्त में मिलता है वहाँ पर, because it was free. So people thought that चलो ठीक है, if something goes wrong, NHS will replace my knee. Probably that kind of attitude they carry, I don't know. But India में if people get to know that they have got arthritis, mild, moderate, severe, जो कुछ भी, the kind of amount of emotional baggage they take is huge. Huge.
How do we address it? By one is helping them understand it's the body.
Yeah, so
One,
it is not
second.
arthritis. First of all, that word itself shouldn't be used for that one. वो इस शब्द का इस्तेमाल करना ही गलत है.
मतलब?
Because it's not arthritis, it is just age-related changes. Although in the medical world we use the word arthritis for that, these are the kind of changes which will be there for everybody. If you go and X-ray 100 people of the same age as you walking on the road, out of them 70 to 80% will have same changes. So how can you class that as arthritis? This is the kind of thing, if it is not explained, people will unnecessarily carry that baggage for rest of their lives. This is a very common thing which I see.
Thanks for probably helping us understand arthritis so that, you don't look at it as a villain and stop enjoying your life.
Exactly.
Sir, now one more thing which your specializes robotic hip and knee replacement surgeries. So इस AI के ज़माने में अभी लोग सब रोबोटिक सर्जरीज के बारे में बात तो कर रहे हैं एंड रोबोटिक सर्जरी मतलब गलत फहमियाँ भी है. कुछ लोगों को लगता है कि एक रोबोट आके काम कर रहा है, डॉक्टर्स नहीं है. बट आई नो दैट इट्स एन आर्म थ्रू विच अगेन ह्यूमन डॉक्टर्स आर ओनली ऑपरेटिंग. सो कुड यू प्लीज थ्रो सम लाइट एज टू वेयर डू वी स्टैंड व्हेन इट कम्स टू रोबोटिक सर्जरीज in 2025?
Absolutely. So robotic surgery is the next level of thing where obviously it is taking the playing platform to next level. But in the sense, in terms of how we do the surgery, what we do, there is a sea change in the kind of things what we do. I agree with that. But one thing to understand, that doesn't mean that conventionally done surgeries जो मैं 25 साल से करता आ रहा हूँ, लोग डॉक्टर्स आर डूइंग इट फॉर लास्ट 50-60 ईयर्स, ये गलत है, ऐसे नहीं है. हाँ, सो द नॉर्मल रिप्लेसमेंट सर्जरीज जो करते आ रहे हैं, दैट विल स्टिल गिव 20 to 25 ईयर्स ऑफ नी विच इज़ वर्किंग इन ए गुड वे एंड ऑल ऑफ दोज थिंग्स, नो डाउट अबाउट दैट. बट वॉट इज़ रोबोट डूइंग डिफरेंटली इज़ अबाउट द वे वी टेक द कट्स इन द बोन, बिकॉज वेन वी हैव टू पुट द इम्प्लांट सो दैट वी कैन हैव ए न्यू सरफेस which is not rubbing against each other. So जो इम्प्लांट को अंदर डालना होता है, उसको डालने के लिए पहले बेड को प्रिपेयर करना पड़ता है. इन द सेंस वी टेक द कट्स इन द बोन्स ताकि द इम्प्लांट कैन एग्जैक्टली मैच दैट वॉट एवर कट्स वी हैव टेकन. तो ये कट्स पहले से हम क्या करते थे, वी यूज्ड टू यूज द, वी हैव इवन नाउ वी डू दैट वेयर वी यूज द मैकेनिकल जिग्स, जिसको इस्तेमाल करके वी कैन टेक द कट्स. सो मैकेनिकल जिग मतलब इट विल बी अ मेटल काइंड ऑफ थिंग वेयर इट विल हैव द थिंग विच विल गिव अस द एग्जैक्ट वेयर इज द bone alignment and all the stuff, and based on that in what angle we have to cut the bone. So it will have a one port which will hold the bone, one part which will actually give us the alignment for the cut.
Like a protractor with a...
Yes, literally like a school protractor and all the things which we used to do in geometry. Vaisa wala kuch cheez. So that's not a wrong thing, because even now that gives a good result. But robot what it does is, इसमें क्या करते थे हम, 3 planes में, मतलब distal and up and down, sideways cuts, and in one angle where it will not go sideways. So in 3 angles, 3 ways we could have made adjustments to make it better. With the robot we can do it in lot more ways. So in terms of rotational component थोड़ा दे सकते हैं, even 1 degree 2 degree का increase कर सकते हैं. So all of those things are next level of things which are really something which will help for sure. बट वॉच दिस स्पेस, क्योंकि रोबोटिक सर्जरीज जो है पिछले 3-4 साल से ही ज़्यादा हो रहे हैं, उसके पहले नहीं हो रहा था. तो what will be the outcome? Will it be better than normal conventional surgery? Because we don't have 25 years of data for robot to say that कि हाँ पक्का ये करेगा. But लेकिन from what we are seeing so far, it's very encouraging. It is something which improves, because even on X-ray and the initial follow-ups we can see how the things are, all of those things. But at the same time, there are a lot of places, lot of times people get promised कि the cut will be shorter, your pain will be lesser. these are all more of selling points. Such में if I am doing a robotic surgery, that's mainly for improving the way we take the cuts, especially in people with lot of deformities. It gives me better advantage to do that, but that doesn't mean that so that doesn't mean that pain will be less or you will not be having any pain at all. It's not that kind of thing.
So it's just improvement in precision.
Absolutely, precision of the cuts basically, so that we can do better fixation of the implants.
उसको छोड़ के बाकी सब डॉक्टर भी उधर ही है,
Absolutely.
सब नॉर्मली हो रहा
Unfortunately,
है.
मुझे ही करना पड़ता है. रोबोट कुछ नहीं करता है. नहीं, रोबोट will do those things, but not everything, of course.
हाँ.
Yes.
और कुछ चीज़ें हैं जिसको लोगों का डर मिटा सकते हैं रोबोटिक सर्जरीज के बारे में, जो गलत फहमियाँ हो सकता है.
बिल्कुल, रोबोटिक सर्जरी लोग क्या समझते हैं, अगर रोबोट ने कुछ गलत काट लिया या कुछ गलत हो गया, ऐसी वाली बात नहीं होता है.
डॉक्टर ही तो यूज कर रहे हैं.
Yeah, because it's all in our control and we keep seeing it all the time, watching it all the time. And when we do that, we know exactly where it's going and we would have calculated all of those things before the surgery. पहले से ही वो सब चीज़ें CT स्कैन करके वो सब चीज़ों को already नाप के on the CT scan, on the computer, we would have made sure that it has to go in a certain way. And even in the middle, agar if we see that that's not fitting the things, we can always change that. It's not like a robot जाके कुछ कर लिया उसके बाद मैं सर पकड़ के बैठूंगा कि क्या करूँ मैं अब. नहीं, ऐसे वाली चीज़ नहीं होता है. So that is something which you don't have to worry about.
कॉस्ट में क्या डिफरेंस है सर, मतलब जो नॉर्मल डॉक्टर वर्सेस द रोबोटिक सर्जरी?
Yeah, so robot itself doesn't come cheap. That's first thing I have to say. Although I don't own a robot, of course, hospital owns it. But robots come at around 5 to 6 CR is the basic price of the robot. So obviously the cost factor
तो
in.
सबको बेयर करना पड़ता है.
तो yes, and not only that, the drapes and all the things robot के लिए इस्तेमाल, क्योंकि robot sterile नहीं आता है, उसके लिए भी obviously you have to make it sterile. मतलब जैसे patient को drape करते हैं वैसे robot को भी ढकना पड़ता है to make sure that it is not unsterile, because otherwise infection होने के chances हो जाते हैं. तो those are all disposable things. So all of those costs are there. So overall cost usually when we use robotics would add on around 30 to 40,000 extra to the tune. That's the rough cost I'm telling you.
So thanks doctor. I think अभी तक हमने ligaments, muscle, tendon, stem cell therapy, PRP, cartilage regeneration, robotic hip knee replacement सब बात कर लिया. Anything that people who are having these kind of injuries and surgeries जो चाहिए उनको, उस category की audience, anything that they have to look out for in the next 5 years कि orthopedics में क्या एक नया आविष्कार होने वाला है?
So आविष्कार तो होता रहता है. ये ऐसी बात नहीं है कि अचानक द ग्राउंड ब्रेकिंग काइंड ऑफ थिंग अचानक हो गया. बट इफ़ यू लुक एट ओवर ए पीरियड ऑफ ईयर्स, आपको लगेगा कि हाँ ये सब नया वाले चीज़ आ चुके हैं. देयर विल बी सम थिंग्स लाइक दैट. बट इन ऑर्थोपेडिक्स व्हाट वी आर लुकिंग फॉर इज वन इज यस रोबोट डूइंग अदर थिंग्स एज वेल. अभी तक लोग आके मुझसे पूछते हैं कि ACL सर्जरी रोबोट कर सकता है क्या. अनफॉर्चुनेटली दैट्स नॉट देयर. सो प्रोबेबली द नेक्स्ट 5 years दैट मे बी समथिंग विच विल कम इनटू vogue, of course. So shoulder ka bhi we are doing surgeries with the robot nowadays. So there are a lot of new things which are coming in there. But yes, I mean उसके लिए इंतज़ार करते हुए मत बैठे प्लीज़. इफ़ यू हैव गॉट रियली बैड प्रॉब्लम्स, दैट्स नॉट समथिंग वेयर यू हैव टू वेट फॉर द सोल्यूशन. बट द सोल्यूशंस आर ऑलरेडी देयर. सही तरीके से इस्तेमाल करेंगे तो बिल्कुल दैट शुड वर्क.
मैं आपका प्रोफाइल देख रही थी. आप इन अ डे you apparently at least see 80 plus patients. That's a huge number. मतलब इतना exposure भी आपको मिलता है कि मतलब what are the kind of problems people are facing, variety in terms of problems, and you've done 110 plus types of surgeries. So what has always challenged your skill or your knowledge so far, sir? What surgery?
In terms of surgical part अगर बात करूँ तो these are all surgeries which a sports surgeon would usually do, because when we talk about sports injury surgeon, मतलब ligaments का भी देखभाल करेगा, tendons का भी देखभाल करेगा, and of course the cartilage का joint के अंदर का lining का, and of course joint replacements and all those things. So it broadens the horizon of what all things we do, because वही तो again there are few things. For example, पहले क्या करते थे, if there is a ligament tear kind of thing, if you have to use a tendon to उसको वापस जोड़ने के लिए या बांधने के लिए, to fix it to the bone, क्योंकि उसको हड्डी को फिक्स करना पड़ता है, because it doesn't get fixed by itself. So उसको fix करने के लिए पहले क्या करते थे, we used to use metal screws. अगर metal screws का जब इस्तेमाल करते तो that metal can actually abrade and cut the tendon completely. Okay, so then lot of new things came into picture in today's day and age. There is one material called PEEK material करके एक advanced plastic based material, and then now we have got all the bio screws and bio anchors kind of thing जो हड्डी बन जाते हैं. तो all of those newer things, what they have made us is we can do more different variety of things to make the patient's lives better, where previously we wouldn't have thought of doing it. Now we can do that. Just again the same example, going back to basics itself, even the ACL surgery used to be such a challenge 30 years ago. Now it's a simple surgery. You have undergone that, you know that it's such a simple surgery compared to what it was, and you saw inside your joint as well, and that's all something which was not happening in the past. So from that perspective, we have got lot of new things which have come in. So that has broadened my horizon. I am doing lots and lots of surgeries. So one of the challenging things for me is when we have to fix something where the tendon is really not in a good state. For example, कई बार क्या होता है,
ये कौन सा सर्जरीज में होता है?
फॉर एग्जांपल शोल्डर में जब when we do the rotator cuff surgeries करते हैं, rotator cuff मतलब शोल्डर का अंदर का जो मसल्स होते हैं, there are outside if you see it is all rotator cuff, the deltoid muscle, inner muscles जो होते हैं, छोटे muscles होते हैं, वो कई बार घिस के कट जाते हैं. So especially in people in their 50s or 60s, quite a few of people we do see them. It's a common condition. So sometimes what happens is when they come late, the muscle would have already gone back too much, in the sense it would have got retracted, because उसका काम नहीं है तो obviously muscle will not stay there, it will just get contracted. तो उसको वापस खींच के भी सही जगह पे नहीं बिठा पाते. Then we use something in between to bridge that. So then the challenge is to heal it at two places. मतलब वो जो ओरिजिनल मसल है उसका एंड पे भी हील होना है, दूसरे एंड पे जहाँ पे हड्डी को भी हील होना है, where we use sometimes the kind of sort of tissue from the side of the thigh, or we do use some artificial materials as well. But all of these things, whether how they can heal back to the place where they belong to, where they're supposed to heal, those are the kind of challenges which are there. Those are fascinating. But yes, I mean, lot of progress happening in these things, but these are very interesting surgeries which we keep doing, and there is no end to an arthroscopy, because arthroscopy camera डाल के करने वाले चीज़ें जो होते हैं, there are huge number of things. For example, just 2 months ago we did एक बच्चे का सर्जरी किया, एल्बो का, 11-year-old with, जैसे हम कार्टिलेज की बात कर रहे थे, he had a condition where his cartilage had उठ चुका था एक जगह से. So it's called osteochondritis dissecans, where the cartilage had been lost. He is a tennis player, so he was not able to straighten the elbow. इतने से आगे नहीं जा रहा था. When we did an MRI, वो एक इडली जो है वो कहीं निकल के कहीं और जाके बैठ गया है, that little bit of cartilage. So then again, like I told, वहाँ पे cartilage तो replace करने के लिए we don't have a cartilage there, so I had to take it from somewhere else, so which is knee. So knee से लेके that one we did use that cartilage plug to fix it. It worked beautifully well, but he's extremely happy, parents are happy. But when these kind of things we have to do for children especially, they carry lot more of emotional baggage. Parents will be worried कि बच्चों का क्या हो जाएगा, ये सब चीज़. And these things, when we used to do them in the past as well, like I said, because scope ही नहीं था तब, we used to do it as an open procedure, lot of scarring, तो I couldn't have given them an assurance कि आपका पक्का ऐसे हो जाएगा करके. Now I can give that assurance, because with the scopy surgeries these things can happen even more better than how it used to be before.
So this is how far we've come, and जो लोगों को समझ नहीं आता है ऑर्थोस्कोपी,
इट्स ए कैमरा, मतलब कैमरा डाल के करने वाले, छोटे से छेद करके, छोटे से कट करके, आधा सेंटीमीटर का कट करके, थ्रू विच वी पास द कैमरा. एक हाथ से वो, एक हाथ से इंस्ट्रूमेंट्स, एक पैर में आई वुड बी प्रेसिंग द शेवर और वॉट एवर. तो लिटरली एक टांग पे खड़े होके पूरा बाकी चीज़ें नर्तन कर रहे होते हैं. That's what it is.
Literally like puppetry.
Yeah, 3 things have to work. You have to use 3 things at least. 1 leg and 2 hands. That's the bare minimum. Sometimes assistants will also have to help, because it's all through camera. So open surgery, the difference being, open surgery में अगर कुछ दिख नहीं रहा है तो चलो ठीक है यार, और 2 सेंटीमीटर एक्स्ट्रा काट लो. You can see the things. In scopy surgeries, if you open more, you can see less, because we would usually put saline into the joint उसको फुलाने के लिए, ताकि we can see the things properly. And the saline will start flowing out, and you will not be able to see what you want to see.
Wow, amazing. मेरे को तो बिल्कुल आपने ओटी के अंदर ही लेके चले गए कि आई कैन सी ऑल दीज थिंग्स हैपनिंग.
आ जाओ एक बार, you can come to the OT itself. Live you can see.
Definitely, sir. So, lastly, when I visited your clinic, I think I saw something around, something was on the wall which spoke about without surgeries, without medicine, anybody who can treat is a
Best
doctor.
doctor.
हाँ करके तो
Yes, yeah. That's exactly what I was trying to say earlier on as well. जैसे हमारे पास मेडिसिन दवाइयाँ तो है ही नहीं. Not everything will need surgery. So that intermediate ground जो है, that is one thing which doctors needs to understand, patients needs to understand. उस चीज़ के लिए for those things एक्सरसाइज के अलावा मेडिसिन के ऊपर निर्भर मत होइए, बिकॉज मेडिसिन आर नॉट गोइंग टू क्योर यू, बट विथ लॉट ऑफ right kind of things. You can take some help from physiotherapists as well. In that regard they come into picture, but again there is a lot of misconception कि physiotherapist मुझे ठीक करके भेज देगा. So it's not like physiotherapist is going to cure you. They can help you to do the exercises better. अगर आपका मसल्स काफ़ी स्टिफ है, काफ़ी कड़क है, तो they can back का for example, they can help you to relax the muscles by doing IFT ultrasound. But exercise तो आपको ही करना है.
So I guess that's how you have the mantra कि you almost treat 90% of your patients in OPD with exercise based treatments. यही आपका एक मंत्रा है ना? ठीक है सर. अब आगे बढ़ेंगे with issues which will now affect the masses. So there are few things like could be myths and categories which I'm going to talk about, and आप हमें समझा दीजिए कि क्या क्या है. Firstly, I'll start with the workout gym के around जो भी है. People usually say if at all if I have knee pain, neck pain or joints का pain, training को बंद करने के लिए. So firstly I think it might start with strength training. So please help us understand strength training and do's and don'ts with people who have existing injuries.
Absolutely. So that's what I was trying to say in terms of किसके बारे में बात कर रहे. See, not one shirt fits all. Everybody is different. आपका प्रॉब्लम क्या है, whether you have any repetitive strain related injuries, जैसे बैठ के काम करने वाले लोगों को स्टिफनेस वगैरह हो चुका होता है, और इज़ इट बिकॉज ऑफ सम काइंड ऑफ इंजरीज इन द पास्ट, उसकी वजह से आप रिस्ट्रिक्टेड हो इन टर्म्स ऑफ व्हाट यू कैन डू, व्हाट यू कैन नॉट डू. तो दैट clarity has to be there, because there are different things for different problems. So if you are talking about people who have got repetitive strain injury, मतलब उनका stiffness के वजह से problems हो रही है, जैसे हमने runners knee के बात किया, we talked about tennis elbow के बारे में बात किया, because people who are on keyboards will get those kind of things. So those are the kind of conditions जहाँ पे bringing that flexibility back to the body becomes predominant thing before they start doing other activities.
That is
there is more of stretching part first and then strengthening part. They will need some amount of eccentric exercise, we call it. Eccentric का मतलब होता है, so for example if you are taking a dumbbell and trying to do a biceps exercise, so this is not the right exercise. More important exercise is how you take it slowly back to make it straight, because that's the time when your muscle gradually stretches, and when you do that slowly, one, you will strengthen that better. And secondly, if there are any injuries or problems in the muscle, the growth factors get released ताकि that can heal. So for that reason, eccentric exercises are important for people who have these kind of stiffness related exercise problems. For them it will be helpful. For people who have had injuries and recovering from the injury or some surgery हो चुका है, उसके बाद मुझे वापस जाना है, there lot of times it will be more of strength related issues rather than flexibility issues, because there the muscle strength, for example we'll take the ACL itself again. तो ACL surgery हो चुका होता है, तो उसके बाद obviously your quads muscles जो है, they would have become a bit leaner and not as bulky as your other leg is.
Right.
So you have to do that kind of strength training to strengthen those muscles. So obviously strengthening of the muscles is the main key bit, but again none of these are separate things. It's not like only strengthening करना है या only stretching करना है. These are all things which go hand in hand. So it's not like one prescribed exercise is enough. We don't go and eat only chapati. We don't eat only roti. We don't eat only rice. उसके साथ सांभर मिलाते हैं, उसके साथ कोई सब्जियां
बोला
लाते हैं.
आपने.
So you need all of those things.
ये
It's
थोड़ा
not
रिले रेस है. 4 लोग हैं.
exactly, yeah.
First somebody
Yes.
is running and giving
Yeah,
it, and the
absolutely.
second
It's
person
just
has
like
to
that.
go.
Exactly.
So इसी में आप बोल रहे हो strength training, stretching, cardio,
Exactly. Yes.
and
And then balancing exercise aate hain in terms of how you do. And last will be agility. So especially if somebody is recovering from any of the injuries ho ya surgeries ho. So this is the rough way of doing it, where you start with first flexibility part and strengthening part, and then alongside with that some amount of balancing part chalo jata hai. At the same time you can start some amount of aerobics as well to make your muscles work in the normal way. And lastly it will be about getting the agility. Agility is sudden movements, swift movements, those kind of things.
सर आजकल देर इज वन वर्ड गेट जो है ये शूज़ को लेके इट इज़ व्हाट गेट अप्रूव्ड और समथिंग लाइक दैट. सो फर्स्टली व्हेन आई वाज रीडिंग अप आई अंडरस्टूड गेट इज एबिलिटी टू वॉक प्रॉपरली. मतलब जिसमें इंजरीज हैं और स्पाइनल कॉर्ड का डैमेज है, सो फॉर किड्स basically helping them to walk. So ये मेरा अंडरस्टैंडिंग है. So please help us understand ये गेट होता क्या है, और should one be aware कि ये शूज़ को जब लेते हैं गेट टेस्ट करा के ये सब लेना है.
So हाँ, इसके बारे में थोड़ा सा समझने की कोशिश करेंगे. See, गेट का मतलब क्या होता है? हमारा चलने का तरीका, हमारा चलने का ढंग जो है. तो the way you walk. So no two people walk same. We are all made differently. The gait components include all the way from how your foot is placed to how your ankle is placed, how your knees are working, how your hips are, and how your back is. So the whole thing where it makes you mobile, this whole thing is called gait. सो गेट का आजकल काफ़ी सारे ट्रेंड चालू हुआ है कि गेट एनालिसिस करते हैं, उसके बाद ही ये करते हैं फलाना ढिमकाना. सो आई मीन आई एम नॉट अगेंस्ट डूइंग द गेट एनालिसिस एंड थिंग्स, बट द प्रॉब्लम विद दैट इज लॉट ऑफ थिंग्स गेट क्लास्ड एज abnormal, बिकॉज this is the thing which we were talking about earlier on as well. अगर हमने एक्सरेज फॉर 30s and 40s के बारे में बात किया और इवन गेट के बारे में बात किया. सो इफ़ वी रियली गो बाय the methodology which gets used, then we have to class more than 50% as abnormal.
कुछ ना कुछ तो निकलेगा ही.
So that is normal for that person. I don't want to call them as abnormal and make them feel that कि rest of their life खुद को कोसते रहे या पापा मम्मी को कोसते रहे कि आपकी वजह से मैं ऐसे हो चुकी हूँ या हो चुका हूँ. So that shouldn't happen. So what I talk about is, so lot of people, you will start with the foot. A lot of people come with the flat foot. That's a very common thing which people come to me with. मेरे बेटी 4 साल की है, उसको फ्लैट फुट है, इसको हम क्या करें? या मेरी बेटी शी इज़ ऑलरेडी 12, 13 एंड नाउ व्हाट शैल वी डू? सो डिफरेंट एज पीपल कम टू मी. Child will be running around, child will not be having any issue. पूरा मेरा क्लिनिक पे उधर मचा रखा होता है, and पापा मम्मी will be dead worried as if something grave has happened. So this is a very common thing which I see. But so having a flat foot itself is not a sin. Almost, if we go and look at the data, there is 15 to 20% of people will be having a flat foot. So having a flat foot is not abnormal. You can't go and put a arch and lift it up to create a flat foot, create an arch. It doesn't work that way. So unfortunately that doesn't get understood, and people get given some arch, big arch supports, and उनका उंगलियां उठ जाते हैं, नहीं तो उनका heel ऊपर उठ जाता है, because they are traditionally flat footed. So in people with flat foot, they will still have, most of them, apart from there are some very small percentage of people who are called pathological flat foot, where उनका हड्डियों का abnormality की वजह से हुआ होता है. That's a different category. But 95-97% of people whom I see as problem flat foot are really having flexible flat foot. Flexible flat foot का मतलब क्या है? They will still have some movement in the foot. It's not like they have got completely stiff foot. So these things will unnecessarily get classed as flat foot. So or for them, although we can class them as low arch, but they have got some arch. And वो arch का जितना भी flexibility है, उसको बरकरार रखने के लिए अगर आप बात कर रहे हैं कि थोड़ा बहुत उनको स्ट्रेचिंग एक्सरसाइज कराएं, फुट का फ्लेक्सिबिलिटी बढ़ाएं, आई एम हैप्पी फॉर दैट. एंड ऑल्सो हाउ द फुट इज मैनेज्ड, मतलब हमारा जो पाँव है घोड़े जैसे आप अज्यूम करेंगे तो दोनों तरफ लगाम लगे रहते हैं. लगाम मतलब ऑन बोथ साइड्स ऑफ द फुट वी डू हैव टेंडन्स, मसल टेंडन्स, जो हमारा काफ्स के साइड से लेके उसको बैलेंस करने वाले होते हैं.
Just literally like
लिटरली लाइक ए हॉर्स, यस लिटरली लाइक ए हॉर्स. तो काफ़ी लोगों में वो अंदरूनी वाला जो लगाम होता है दैट विल बी मोर स्लाइटली ढीला होता है, बाहर का थोड़ा सख्त होता है. बिकॉज ऑफ दैट इम्बैलेंस बिटवीन द टू, फुट का मुंह मुड़ जाता है, मतलब घोड़े का मुंह मुड़ जाता है थोड़ा सा बाहर की तरफ. तो दैट्स द रीज़न लॉट ऑफ पीपल विल बी हैविंग हील गोइंग आउटवर्ड्स. वो जब चप्पल पहनते हैं, चप्पल में कई अलग अलग जगहों पे दे विल सी ए बिट ऑफ खड्डा.
the heel mark, right?
All of those things are there. That doesn't mean that they have got something really wrong, but yes, they have got slightly higher chances of, because of that, getting some plantar fasciitis हो, heel pain हो, या because of that they can have an impact on the knee as well. knee का issues चालू हो जाता है कुछ लोगों को, ये सब चीज़ें. but blaming that is not a solution for that. it is about making whatever arch is there उसको वापस flexible रखो, अंदर का जो लगाम है उसको और मजबूत करो. doing exercise for that particularly will actually improve the overall the way the foot functions. This suffices for most people.
So
Footwear can be changed to make that more supple kind of footwear, more flexible kind of breathable soles. But just changing that is not going to make your foot better. You have to make your foot better rather than blaming the footwear.
So gait is not for everybody. आजकल ये gait analysis करके अपना running shoes ले लो, ये वो सब जो trend शुरू हुआ है.
So yeah, that's what I mean. That becomes a selling point for people rather than that really identifying issues. So yes, I mean if somebody has got really flat arch, उनके लिए एक छोटी सी arch देखे can be done. Nothing wrong with that. They're custom made आते हैं उसमें. That is something which if they are really having symptoms then करना बनता है. Otherwise just because वो अच्छे लगते हैं, posh दिखते हैं, it doesn't mean anything really.
So there's another trend which is your orthopedic slippers, happy feet करके कुछ तो brand देखा मैंने. So who needs this? और is it मतलब आजकल कोई भी कुछ भी अपना Google में डॉक्टर बन के पहन रहा है.
Yeah. So foot का जब बात करते हैं, so yes, we do see lot of foot conditions. मतलब almost 1 out of 2 persons would have had plantar fasciitis in their lifetime. मतलब एडी का जो पेन होता है, चलना चालू किया तो एडी के नीचे पेन होना, हील पेन जो बोलते हैं, हील स्पर बोलते हैं चंद लोग. तो दैट्स अ वेरी कॉमन कंडीशन विच पीपल हैव. सो दैट इज अगेन partly because of the lack of flexibility of the foot, partly it could be because sudden weight gain की वजह से हुआ होता है, or again sedentary lifestyle. Bechara footwear gets blamed for everything. But yes, but as a rule of thumb, I would say if somebody is wearing very stiff soles, मतलब जैसे कोल्हापुरी चप्पल जो होते हैं, जैसे when you turn it and sole को ऐसे bend करने की कोशिश करें, if it is very stiff, then that's not a good idea because that will keep your overall arch become more stiffer. तो उसकी वजह से you will unnecessarily have more issues.
So इसका मतलब कोई भी footwear खरीद रहा है,
yeah,
need to check the sole, see the flexibility.
Yeah.
So
that kind of thing is a simple test, I would say. That's not everything, but that is one thing which I would recommend for just as a simple test. Because इसको लोग बहुत complicated बना देते हैं. That's the kind of worry I have. So for example, why I talk about footwear not being that important is, if you take people who walk in the forests and in the पहाड़ों में, जो सिद्धि लोग जो बोलते हैं in all of this
बाबा लोग कुंभ मेल and then वहाँ पे
and करावली एरिया में जो होते हैं, especially in the western ghats and all, तो उनमें they never have plantar fasciitis. This has been checked, this has been examined and checked. They don't use any footwear, they walk, their feet adapt to the ground wherever they go, so they don't get this kind of plantar fasciitis. Plantar fasciitis हमारा क्या धरा है. We get that because of yes, I mean so
and we are mostly walking on roads
we are walking
and
on the
city.
kind of exactly not the kind of no, I mean Bangalore, all our counselors are doing very great job because yeah, so that we can adapt to the ground as well. All the roads and pavements are so great. That's a different thing. But yes, I mean yeah, in every city probably it's the same thing. But yes, but the main rule is about footwear को ज़्यादा कोसने से पहले we better make our foot become more flexible, do the stretching exercise properly. Footwear, yes, it will play a small role, I agree, but yes,
so
more
आप बोल
flexible.
रहे हो ये icing on the cake को मत देखो, पहले केक को तगड़ा बनाओ.
Exactly.
So you keep the foot intact with proper stretching exercises and all of that.
Absolutely.
So any tips that you would like to give, because I also want to cover heels, including me. I wear heels, but I know that heels is bad, but still,
Yeah.
how do I do both? Like, where, whenever I want, is there a frequency that I should have in mind?
Yes. So that again, Rashmi, the answer is same. Because if you keep your foot more supple, more flexible, जैसे मैंने अभी बताया, doing a bit of stretching for that. 5 मिनट का stretches होते हैं, ज़्यादा कुछ करने की ज़रूरत नहीं है.
क्या क्या करना
If you,
पड़ता है?
it will all be something where you use a towel and pull it backwards. एक roller या बेलन
मतलब
पे
ये
आगे
मेरा
पीछे.
फुट है, आप
Yeah.
थोड़ा करके दिखा सकते
Yeah,
हैं क्या
so
क्या
it
कर
is
सकते हैं?
basically stretching the toes backwards, that kind of thing with the towel and hold for 20 seconds kind of thing. एक रोलर या बेलन को नीचे रख के उसके ऊपर पैर को आगे पीछे करना, जस्ट प्रेसिंग दैट वन एंड डूइंग दैट वन. उंगलियों से, पैर के उंगलियों से लिफ्टिंग अप द towel. So these are all dexterity we have been given by God for our foot to do all those businesses. We have not done it for a while, so our whole system becomes stiffer. So these kind of simple 4-5 things, and you can sit and with your leg on your other leg and just pull the toes backwards and hold. Very simple
ये
4-5
कभी कर
stretching.
सकता है अभी जब मीटिंग में है, कुछ बात कर रहा है.
Exactly. So because we don't do those things and then suddenly one day we want to do everything, then nahi ho payega. So keep our foot flexible. That's the whole idea of keeping it better. So yeah, I'm not saying that wearing the high heels is completely wrong, because I would be really trolled badly if I say that. But at the same time, if you are wearing it just for occasions and not make it as a habit to do that every day, that's better, because our foot is not designed to be in that angle. So obviously it will take a brunt. But if you are giving it less trouble, your foot will keep you happy.
So my next doubt, representing what our audiences would want to know, is yoga. Usually they say while you're practicing yoga, there could be some injuries that can come to the joints, overstretched joints, and all of that. Ye such hai? Especially like downward facing dog, some other poses.
Absolutely, yes. So yoga is a great thing. I don't want to demean that by any way, any means. But at the same time, we need to understand yoga is a science, yoga is an art as well. It is an exercise at the end of the day. So just like any other exercises, if you overdo or if you underdo or if you don't understand the principles of that, you will end up having issues. Same thing applies for that. For example, one simple thing which I may say, Surya Namaskaram. Surya Namaskar is such a nice exercise where it will exercise all the parts of your body. Vyayam karata hai. Sab kuch theek hai. No, nothing wrong with that. Because from stretching your calf muscles, when you start with that posture, and your hamstrings will get tighter, and then your back muscles will work as you go down. It is literally like a plank, and then when you go up, your shoulder muscles will work. You will stretch your back muscles, and then so by the time you have done the whole of one move, you would have worked most of your body muscles, no doubt about that. But yoga को yoga समझना ज़रूरी है. It is not a race or it's not an aerobics. I have seen people doing literally like as if it's some aerobics, doing it 20-25 per minute.
Speed पकड़ते हैं.
It is not an, see, yoga
Form
is a
नहीं.
stretching exercise at the end of the day. It's not an aerobics. Aerobic exercises are there where you do jog, run. All of those things are aerobic exercises which are there for losing calories. This exercise particularly is to make your ligaments stretch to the max, make your muscles stretch to the max, make them work in a perfect way, and get that flexibility back. So when you try to use that as a completely different kind of exercise, then obviously people will end up having back pains or neck pains, all sorts of things. So a lot of yoga exercises, that's what, because yoga is stretching plus loading plus stretching. So even if you are doing a Shirsasana, for example, where you are loading and stretching, if your muscles are already sensitive, if your neck muscles, आपका muscles अच्छे condition में नहीं है, and you have got a bit of ache from last couple of days, आपने पूरा दिन बैठ के लैपटॉप पे काम किया, and your muscles are stiff, and then you want to do a शीर्षासन, मैं करूँगी आज या करूँगा आज, then obviously the muscles will suddenly go into spasm, and then आपका एक दिन का छोड़ो अगले एक महीने का exercise workout छूट जाएगा. So that's why all of these exercises have to be understood, their importance, उनका मायना क्या है, how they have to be done. ये समझ के अगर करेंगे तो then they work as a beautiful thing.
So next on the line is cardio. Cardio में dance fitness, aerobics, उसका impact kya hai on the knees, because these are all your new age
Exactly.
fitness
Exactly.
routines, regimes, which has just
Yes.
started probably 10-15 years now.
Correct, yeah. Yeah, I mean, that includes a whole gamut of things. Now, Zumba has come to that, and a lot of things. I mean, people do all sorts of things. So, when we talk about aerobics, again, the same rule applies for that one as well. When we start anything new, especially if you have not done that for काफ़ी अरसों से नहीं किया है, and suddenly if you want to do something, then the first thing you need to understand is how your body is, your knees are. So if somebody is, for example, planning to start session from next week or something like that, not a wrong thing, but at least start with the basic stretches, proper warm-ups, cool-downs पे ध्यान दो, and start slowly. And just because somebody next to you has been doing at a pace where they are doing it, doing the dance fitness for 1 hour continuous, that doesn't mean that you have to start with 1 hour. You can start with literally 5 minutes, 10 minutes.
Listen to your body.
Yeah, exactly. And then gradually increase the duration and then intensity. If that is done, then the chances of somebody getting injuries will become much lesser.
So there is no study which says, because it involves a lot of jumping, knee पे वो long term implications क्या हो सकता है?
So see, I'll just bring one example for this one. क्या हुआ? Once I took my aunt to one of the very old style orthopedic consultant. This was some 25 years ago. I was still in MBBS at that time, and or 30 years ago perhaps, yeah. And then she was 55, 54, 55. She was still quite, she was quite well built, and she was otherwise normal kind of woman with a knee pain. So the consultant said one thing, see, you have walked more than what you should have walked for your age. Then this word became like a kind of sentence which is written पत्थर के लकीर जैसे हो गया उनके लिए. She was like, उसके बाद चलने के लिए रेफ्यूज करने लगी औरत. That, I mean, so how people take when we say these kind of words, I mean, because see, as doctors sometimes we don't understand the power of the words or sentences or phrases we use.
Right.
Because for patients it may be one thing which is written. That's why I was telling you, even arthritis का word जब इस्तेमाल करते हैं, तो all of these things when we do, each of our words have to be measured because they carry lot of meaning, lot of kind of, it's a heavy thing for them, so that we need to understand. So the same thing, why I came to that one was when we talk about somebody doing more and more activity, nothing is wrong, because people do marathons as well. Marathon करना गलत है क्या? नहीं. But what age you are starting, how much you are doing, is your body working in the perfect way, or are you keeping it in a good way so that you can sustain that for long term as well? So all of these things, if we do correctly, then doing all those activities मैं मना नहीं करता हूँ. Because I have heard this one. I have heard patients coming to me and telling me that कि नहीं sir, we had been to a doctor, an orthopedic surgeon, and उन्होंने बोला कि सब कुछ बंद कर लो, रेस्ट कर लो. हाँ ठीक है, बट रेस्ट कब तक? Permanently? That's not a right thing, because see, at the end of the day, these are people who want to go back and do the activities. उनको सब कुछ छोड़ छाड़ के बैठ जाओ करके, that's not the right thing. I mean, yes, of course, if they have got a bad pain, एक हफ्ता 2 हफ्ते के लिए उनको रुकवाते हैं, and at least start the stretching exercise or whatever is required for that, so that it becomes a remedy. Completely resting or not doing anything is never going to solve anything. उस गली जाना ही नहीं, that's not going to help anybody.
So it has to be measured. So you used a sentence, if it has to be sustainable. So I'm going to represent our audience's curiosity. All the new age exercises, all the new age routine, if I have to be sustainable, doing all of this and also still remain mobile, what is the word?
Of course, mobility.
Mobility,
yes.
Right. So if my mobility has to be there even in my old age. So how do I do a sustainable routine?
Exactly. So absolutely. So see, that's the thing where I told you about not just eating roti. So it's a mix of everything. It's because a lot of times people, what they go for is the one which has been advertised the best. So I mean, a lot of times people will find it hard to understand the difference between each of these different things, because it's been advertised by Hrithik Roshan. Yeah, that's the best one, or somebody else. So that kind of modality people go with. It is about getting the right mix, again the same thing, in terms of right amount of stretching, whether it's in the form of yoga, pilates, jo bhi ho, right amount of aerobics, which can be in the form of dance, fitness or zumba or whatever, and a bit of strengthening and conditioning, S&C.
Dumbbells.
Yeah, it can be weights. Some amount of weights are absolutely right. Body weights or free weights.
Isometrics.
Yes, absolutely. So these are the three basic ingredients which have to be touch based upon.
Every week.
Absolutely, yes.
You have to have a calendar.
Yes. So if you are hitting the gym or some kind of fit kind of places, then these three has to be a right mix of these three things. It's not like you will go and do dance fitness all 7 days a week. So that right mix has to be there, and then maybe 1 or 2 days of gap as well, so that your body can recover from all of these things. So that kind of regime will keep you sustainable for longer periods of time. In addition to this, if you want to do, like we discussed earlier on, some balancing things or agility, that's a next level of thing, of course.
Agility में यही होता है, footwears होता है, and jumping. I play badminton, no, so obviously running,
that's an exercise, of course.
Side running, shuffles, and all of that. So अपने sports के हिसाब से या activity के हिसाब से, you can also do the agility and the balancing.
Correct.
So next thing is the villain, which has been made, I don't know, probably by a few wrong statements, I don't know. Treadmill. So treadmill में भागने से flat surface है, runners knee आता है. So is it true?
So runner's knee can occur with any of the activities. So it's not like treadmill की वजह से ही सब कुछ होता है, ऐसी बात नहीं है. But again the same thing applies here, what we talked about earlier on. Treadmill is something which gives you the bit of even surface, especially if you are starting to jog or run after a gap or after an injury, if you are recovering and then starting, then it's a good place to start off with.
It's a nursery.
But yes,
not
exactly.
a permanent playground.
Yeah. But because again the foot adaptability will not be there. Same thing if you are running on our beautiful roads, then it will be something where your foot adapts to the ground, which is better actually for that matter. Or if you have got a more of a turf, which is more of a near our agara, like we got the kind of muddy track, those are even better. So where your foot adapts to the things, because that will give you a better proprioception for the foot and for the knee as well. That's the reason. Yes.
Thanks for clearing this, sir. Next हमारा doubt है कि there is hot pad and cold pad. कब क्या use करना है पता नहीं है.
This is a perennial question. I think I answer this question every day at least some 15 to 20 times. Yes. The reason being, see, this is the confusion because there is a lot of different concepts about that. I keep it very simple. I don't want to confuse myself or my patients. So what I say is, whenever there is an injury where you are at risk of sudden swelling, say for example an ankle twist or something like that, or you have got some bleeding and there is a bruising in and around the joint or something, then cold pack is the right thing to do, because cold will reduce the circulation there, cold will make your pain become less,
numb,
and it will make your swelling get shrink. So for all of those reasons, 5 to 7 days of cold packs is a beautiful thing when there is an acute injury, whether it is a head injury where you have got a bit of big bruise, or whether it's something related to ankle or knee, whichever. But that's the right thing to do, apply, because cold will improve the things there. Heat is something which I use for all the muscle stiffness, muscle tightness kind of things, because heat will improve the flexibility of the muscles. Heat will make the muscles become more supple, and heat will also improve the circulation. So for the muscles to return back to normalcy, the flexibility is required and the circulation is required. A cold frozen muscle is stiff, a warm muscle is flexible. Simple. So we want those muscles which are already stiff to become flexible. उनको और कड़क नहीं बनाना है हमें. So for that reason, even though cold may make your pain better for a back pain or something like that, but ideally heat pack will help you better. Heat and then stretching, that will be better.
So now I understand warm-ups better. Why they talk about warm-ups.
Exactly.
Warm-up is nothing but it is warming up your body so that muscle becomes supple and doesn't get injury.
And you can use a cold pack at the end of the exercise to cool down, because if the muscles are already overheated and lot of inflammation, तो उसको घटाने के लिए you can use the cold. That's not a wrong thing.
So next thing, I'm sure you might have come across these pain relief oils का question, wherein people say इससे हम काम निपटा सकते हैं क्या?
निपटा सकते हैं करके.
So
So
is it a permanent solution?
See, if there is a muscle stiffness, muscle tightness है, आपको muscles में कुछ issues है, तो applying a bit of warm oil, warm coconut oil हो या सरसों का तेल हो, जो कोई भी, और even some kind of gel which is डाइक्लोफेनाक हो या कोई और, या कोई magical जो तैलम होते, जो तेल इस्तेमाल करते, any of these, the function is to make the muscle become a bit warm and stretchy. So if you know how to massage a particular muscle, if you know the alignment of that muscle, then उस muscle के along अगर आप मलेंगे थोड़ा सा, तो that will give a relief, no doubt about that. But if you expect that magical tail to go inside your joint and make your joint go back to some normalcy, then I don't know what to say. All the best.
I think you answered it. So you believe these oils are only for muscle relief and not for fixing your ligaments or your joints.
Yes.
There's a debate happening about mattress. Is it a soft mattress or hard mattress, or even sleeping on the floor or on the mat? So what is your observation in this,
Yes.
sir?
I wish by answering all of these questions, then my patients will stop asking these questions every day to me. So yes, this is a very common question I get asked regarding the mattress and the pillow. These are the two things which we always get asked about. So again, because of lot of ads, advertisement, orthopedic pillows, orthopedic mattresses, so people get very confused about these things. Multiple layers of different cushions, all sorts of things. I keep it very simple. The mattress should be firm. It shouldn't be soft and fluffy, and it shouldn't be sagging. If it is too old, it may be sagging. That shouldn't happen. And it should be firm enough. It shouldn't be soft. That is the main thing regarding the mattress, which will keep your back happy. But again, whatever we discussed about the foot, same thing applies for this one as well. It's not the mattress which is the main thing. You make your back better. Again, exercises and stretches and all the things. Mattress plays a small role in that, but importantly, you keep your muscles in a better condition. And pillow, again, same thing applies. Pillows, a lot of people will have a habit of using very thick pillows, 2-3 pillows that will literally make their neck become bent. That's not a good idea. So having a thin but firm pillow will prevent your neck from going too much to one side when you lie down onto the side. That's enough for you, whether you're lying down on the back or on the side.
Some people also believe in not using the pillow at all. Do you advocate that?
That one, the problem with that is, yes, like I said, when you sleep onto the side, your one side neck muscles will get overstretched. So that's why a thin but firm pillow is good enough.
Next, today here we are in the digital era. People are busy on the phones mostly, and the posture itself is this more so, which never used to be before. How has this changed the neck and the problems further? And what are the kind of cases that you're seeing, and do's and don'ts for people who are always hooked onto the phones, sir?
Huge. So whether it's phones, whether it's laptops, they all make you sort of bend your neck and do look at them because they are not at your monitor is not at your eye level. So that puts a lot of strain on the neck muscles. If you are looking at a monitor or a screen for 10 minutes, 15 minutes, or even 45 minutes, 1 hour, it may not change anything. But if you're doing the same thing 6 hours, 8 hours throughout the day, day after day, then obviously the muscles will get irritated because of that. And we see huge number of back pains, neck pains, which I honestly feel that they shouldn't be really having these things because that's something which we don't want them in our clinics, because they should be getting better by doing simple adjustments to their heights and things where they keep their monitor at their eye levels, and proper exercises and stretches.
So how to avoid neck and back issues, elemental level?
So see, that's again the posture and sitting jobs. These are the things, again it will come to the same thing. So during COVID especially, the joys of work from home, people started working from home, and the sitting posture, it didn't become work from home, work from bed हो गया वो, तो bed से बैठ के ऐसे करके when you start doing the things. So that sort of became a very big triggering factor for a lot of people to end up having neck and back issues. And the problem is, the longer you have left the neck and back problems without addressing them, they become more stubborn, because for the muscles एक pattern बन चुका होता है जहाँ पे they are already in that mode where they don't want to work in a normal way. तो उनको वापस retrain करना ज़्यादा मुश्किल हो जाता है if you have left it for longer periods. So once you, if you are, prevention is better than cure, of course. So in terms of posture, how you sit, how you do the things, because back support is proper, back support is important. There are ergonomic chairs which you have to look into, monitor your eye level, those kind of things. And the important bit is, if you are sat down for an hour or so, even if it is for 3-4 minutes, get up, and there are some ergonomic stretches you can easily find on Google as well, doing those stretches and again sitting back. So you can work 10 hours, 12 hours, not an issue, but that 3 minutes what you spare every hour will make a big difference. Those kind of things will prevent it from happening. अगर आपको हो चुका है back pain already, if you are having, the important bit to understand is it something coming from the nerve problem, or is it just the muscle problem? This is the important bit to understand. Because there's a lot of confusion about this one, I see. Because when people have back pain, they, in a lot of places, they get MRI scans done straight away, or people who demand that मुझे एक MRI scan चाहिए. So once we do MRI scan, yes, you may be 35-40 and you get an MRI scan done. What is your chances of that showing a disc bulge? It is 60 to 70%. In the sense, normal population who are walking around in the road, उनको पकड़ के हम ले जाके 40-year-olds को MRI कराएं. So this is a proven thing. You can find enough evidence for this. Out of them, more than 60% will have some disc bulges in the neck or lower back. This is something, if you are 60, around 55-60, then the chances of the disc bulges being there naturally is almost 80%.
Oh, you.
This is something which happens because we started as 4-legged animals and then we started becoming 2-legged animals. So we are only 2 species up with the 2-legged animals. Only chimpanzees and gorillas थे and हम आ गए. So उसके पहले सारे 4 कदम के साथ ही चलते थे. So because of that, what happened was, that's a price we are paying for standing upright. So that improved all the activities hugely. Our shoulders started working hugely. Our eyes started coming to the front. All of those changes happened. But back is one thing where, as of now, this species we have not mastered making it perfect. Probably in another 1 or 2 species down the line it can become. But as of now, if you go and look at the evidence, even for chimpanzees, there are disc bulges without them having any problems. So that's a common thing because of the standing straight. So now once the scan is done, of course the report will say कि हाँ इनको disc bulge है. Then that एक बार ठप्पा लग गया, तो that's it.
So
then,
don't get scared. It's a normal problem.
Yes,
So
I mean,
it's
so
a species problem.
If somebody has got pain shooting down the leg, numbness हो रहा है पैर में, या tingling or weakness in the muscles in specific areas of the leg, and then on the same side we are seeing a disc bulge which is pressing on that particular nerve, then तब उसको blame कर सकते हैं. Not every disc bulge is sciatica or not that kind of thing. This is the confusion. And then when we see prescriptions coming out, एक पेन किलर भी दिया गया होता है, एक मसल रिलैक्सेंट भी दिया गया होता है, एक नर्व मेडिकेशन भी दिया गया होता है, एंड एक सम अदर स्टेरॉइड भी दिया गया होता है, स्पेशली फ्रॉम नॉर्थ आई सी लॉट ऑफ स्टेरॉइड्स कमिंग. तो कौन सा काम किया, कौन सा दवाई काम किया, कौन सा दवाई नहीं किया, बंद करने के बाद अगेन यू आर बैक टू स्क्वायर वन. So this is a very big problem which is not getting understood by, I'm not blaming public at all, even amongst a lot of orthopedic surgeons that awareness is not there, and just yahi dawaiyan diya jata hai, which is not going to change anything. Not every, even if you are talking about a proper IVDP disc prolapse where people are having sciatica, not every one of them needs a surgery. 90% of them, the disc जो bulge होके दब रहा है नस को, that will start drying up. जैसे अंगूर ड्राई होके छोटा हो जाता है, just like the grapes dry up and become small,
The bulge भी कम हो जाता है.
they dry up and that will stop pressing on the nerve. For that process to happen, it will take 3 to 4 months. तब तक क्या हुआ होता है, the guy would have gone to first doctor, उनका दवाई थोड़ा काम किया, उसके बाद ठीक नहीं हुआ, second doctor, third doctor, fifth doctor, 10th doctor तक आने तक the things would have naturally gotten better. And then that doctor gets all the credit and he is the wonderful doctor in the world. So this is the thing. So yes, कहने का ये मतलब है कि It's not something where everybody needs a surgery. If they have got a proper disc bulge wala sciatica, fir bhi, lot of them can get cured. There are treatments, regimes, exercises, all of those things are there. A very small percentage of people, around 10 to 15% at the most, will need a surgery for that. Or in a very small percentage, even lesser, where they have got bowel and bladder problems because of the nerve compression and all those things. That's a different category altogether, where we have to do it as an emergency spine surgery. That's a different category altogether, which is a very small percentage of people.
So next is ये जो bikers है आजकल के जो fancy bikes है, you have to bend, high end bikes and potholes and speed breakers, इन तीनों को मन में रख के how does one take care of his or her back, do's and don'ts there?
Yes. So the design for that one came because of ergonomics. Matlab not because of your back ergonomics. It is because of how you can streamline yourself to the speed and
Of the
achieve
bike,
of the bike, so that you can perform better. It's for performance basically. But when it came to the back portion, especially if you are bending forward and doing that for hours together, which is what a professional biker would do, then obviously the back muscles will all become stiff because it's not in the right appropriate position, and over a period of time they will end up having tremendous amount of issues. So if you want to adopt bicycle riding as a hobby, then getting an upright one where you are not really bending forward would be ideal. For those professional bikers who have to do that, cycle basically, bicycle. Those who have to do that,
Bicycle and also the
or even bikes, yes,
bikes,
of course,
yeah.
So those who have to do that, if they have to do that for longer periods, there again same rules apply: proper warm-ups, cool-downs, and stretches once they before that. And
of the muscles. Strengthening of
yes,
the
of course. And strengthening those muscles is an important strength, in the sense when we talk about the back, it's all about core strength. Because see, the back is supported by the core muscles. So in the sense, our back muscles are just to make you do this one. The ones which start from the head and go all the way down. But there are a huge group of muscles which are core muscles, which are around your tummy, and even some of them fan to your chest as well. So those are the muscles which are equally important to keep your back in a good condition. So especially bridges, planks, those kind of static exercises to keep the back muscles core muscles in a good condition are important. Because again, that brings me to the exercises which are to strengthen the core muscles, to get that six-pack kind of thing. Not wrong, but when people are trying to do it, the sit-ups and all the things, especially if they are trying to yank their neck and try to get that movement rather than tightening up their core muscles and getting that movement, then they are doing more harm for themselves rather than building up their core muscles.
Next comes the massage guns and the foam rollers.
Yes.
So people who are into fitness,
Yes.
Is it a mandate?
So see, none of these are mandatory things, but for people who are athletics, who are regularly, they will have some niggles, some aches or pains यहाँ पे इधर उधर, थोड़ा बहुत दर्द, थोड़ा बहुत muscle stiffness, हर एक चीज़ के लिए they may not be able to go to the doctors. As long as they understand those pains, that they are not bad pains, they are just because of their slight overuse, or उस दिन थोड़ा सा खिंच गया जिसकी वजह से थोड़ा सा muscle ache. So for those kind of things, using those gadgets is not a wrong thing. But again, that's not an alternative for stretches and warm-ups and cool-downs.
Next comes in the list, couch and sofa and the rocking chairs. Everybody knows it's bad for the back, but still it's become an accessory in every home.
Yes. So for recreational purposes, we all use those things. We can't always be sitting on ergonomic chairs, which is a fact. But at the same time, if somebody is literally working from the couch, or literally sat in front of that all day watching telly, then obviously that's not an ergonomic position for the back, and muscles will start becoming stiffer and cause problems. So if somebody is doing sitting for longer periods, like we say the same thing for people who sit on the laptops, in the same way, getting up, stretching a bit and then sitting back would be better actually.
How do you look at these influencer advices on social media today?
Tremendous. Social media influencers have a huge role to play. So 10 years ago, 15 years ago, that was literally non-existent. But now that's a new generation of people, where It's not just some hero or heroine doing the things. All the social influencers are heroes and heroines nowadays, and that kind of power comes with a kind of responsibility
Responsibility.
as well. Because when you are an influencer, if somebody is an influencer who is at a position where a lot of people are listening to their reels or podcasts or their whatever kind of things they are doing in social media, so then if they're getting lakhs of people who are following them and looking up to them basically as role models, so that's a good thing that people are not just looking at few Bollywood heroes or heroines as big people, or they are looking up to all of these people. But that comes with a responsibility. So, of course, social media influencers do carry that part, and I can see that a lot of them are doing that bit of things as well. Because I do see and follow few people in Kannada industry itself, or even some Hindi influencers whom I keep seeing. For example, in Hindi, Sham Sharma show keeps coming on a regular basis. Yours, of course, I keep watching, and some of the others. There is one guy who travels all over the world and he does some videos. So all of these things.
Nas Daily
Um,
or Dr. Bro? I don't
Dr.
know.
Bro, yes, yeah.
Okay.
So there are a lot of these kind of videos which we all watch. I mean, so everybody, literally, even though time is limited, still I would have watched quite a few of these things. So when that is the case, and when the kind of things which you say or which you take it to next level, where that is something which, say for example, simple things like posture, for example, what you do or what an influencer does matters for people as well. How they do the things they try to imitate, because once the TikTok came, the same thing became a fad. In the same way, people subconsciously will definitely follow. So yes.
So what to give and what not to? For example, my husband Davis, he had a personal experience. He saw somebody giving an advice through a reel, and he tried some hot towel therapy to the neck, and it elevated the pain. So I mean,
Exactly.
where to draw a line? What kind of tips should one blindly go for, or when should they go to a physio? Or when should they go to an ortho?
Yes. So this is a story which I will take you back to a bit, because see, for that matter, India is a nation of healers. Uh, Everybody is a healer in India. Why I tell you this one is one particular incident brings to my this one. So what happened was, I was still in UK and I had just come for a short vacation, and we decided to go to Nandi Hills. So it was a weekend, huge crowd. Reaching on the top was a huge, massive thing. So even when I was going up, I was thinking, how the hell are we going to come down, because there was such a huge crowd. Once we went up there, my son did a monkey business. He tried to climb a tree. He was 12, 11 or 12, something like that. He fell down from a almost 15-foot height. I was like, my heart came pounding to the mouth, and I was thinking that he must have broken his spine. The way he fell down with a big, huge thud. I was literally standing some around 5 to 7 meters away, and then a huge mob ran towards him. There were like literally 15 people who ran towards him, trying to help him. No doubt about that. That's fine. They were all enthusiastic. And one guy started giving him water. One guy started making his leg move in all directions. I was like, gosh, don't do that. It's my son. I want to see him. They said, sir, you don't worry about that. Hum take care kar lenge. I was like, look, I am an orthopedic surgeon. Please allow me inside. So then, see, there's nothing wrong with people's enthusiasm. But when they try to help, sometimes it can misfire, because if there is a spine injury, for example, fortunately he didn't have any spine injury, touch wood, God was great that day. So if he had a spine injury and somebody moved his neck to make him drink, or somebody made his legs bent over, whatever was still sort of sitting in a bad angle would have completely come apart, and the spinal cord would have been compressed. People have lost legs because of these things.
Oh,
so in India, even now, when I see all these the kind of accidents and the kind of trauma things which come on the TVs and all the stuff, the way people carry them, एक बंदा ऊपर दो हाथ को पकड़ के रखता है, एक बंदा नीचे पैर, and head will be latkofying backwards. My heart comes out when I see that one, because that's a thing which is the gravest thing one can do. जहाँ पे मतलब if somebody is really injured, suddenly पानी पिलाना, especially if they are not conscious enough, और उनका neck को अलग अलग दिशाओं में bend करना. These are the gravest things. UK में first thing when I went and got the training, it was about how to make sure that we transfer that patient safely to the hospital.
कैसे
So
समझा सकते हैं?
there has to be 4 people who do that. They always, you need a kind of support trolley. There has to be specialized kind of thing to pick them up into that board. India में you may not find that kind of board, but at least you will have to have ये जो यहाँ पे लाते हैं, the kind of thing. Even for that one at least, but making sure that we are turning them with somebody holding the head and stabilizing, and एक side पूरा body को roll करके नीचे उसको खिसका के pushing the board down and then roll them back. So one person has to be in the control of the neck and take them back to the position. This is
तो ऐसे जाके ऐसे उठा देते हैं.
exactly. This is as big a problem as having a heart attack on the road, because lot of people have lost their completely legs because of this one, because it causes paraplegia. If that kind of things happen, there is no way of doctors retrieving that spine back to normalcy. So this is the kind of thing which we have to be very careful about, and unfortunately in India that mechanism is not there. Even today we see, every time I see TV I cringe about that one, but that's the way it happens, unfortunately. So the thing which brings me back to that point is, so when we have when all of us try to heal, all of us people do it in a good will, not like they are trying to कुछ तोड़ मरोड़ने की कोशिश कर रहे हैं, नहीं, but at the same time people need to be trained for these kind of things, in one thing. Second thing, people who don't know about those things, I mean ऐसे गलत एडवाइस देना या यही कुछ बोलना on this one, उनको मदद मिला ठीक है, अगर हाँ मुझे हार्ट पैक लगाने से मदद मिला ठीक है, बट इसका ये मतलब नहीं कि हर एक बंदे को उसी से मदद मिलता है. So that's the kind of generalization causes problem, and especially if social media influencers do that, it becomes even more difficult, because a lot of people go with their advices.
So check and be sure, is that your area of expertise?
Absolutely.
And
Yes.
then even people who are watching, you need to know who is giving it, and then
Yes.
you have to do your R&D is what your
Absolutely.
thing would
Yes.
be. I read it somewhere. They said don't break anybody's heart because they only have one. Break bones because you have 206 in the body. Now, though this is a joke, coming to the reality, let's say suddenly if somebody has broken a bone of theirs, first aid, how should one take care of themselves, sir?
Yes. So when we talk about the bone fracture kind of things, the important bit is how you manage it in the first few
Initial
hours.
stage. How do I know if it is a fracture?
Correct. Yeah. So the fractures are more painful, I can say, compared to ligament injuries most of the times. So if there is a fracture, the kind of pain or immobility, in the sense, say for example, if you have fractured this bone, the big bone in the leg, you wouldn't be able to walk. There's no chance that you will be able to walk. So that's one simple indication that it must be a fracture. Or if you have broken a forearm bone, for example, then the kind of movements will be very painful. You will not be able to do that, or even if you try to do that, there will be some amount of shooting pain over there. These are the kind of things for big bones where you can understand it more easily. And if that is the case, of course, seek help. And in the immediate point, at that point of time, even wrapping around with some kind of support, which may be a sari or shawl or something like that, or even if it is a leg, some kind of support, a wooden plank or something, just to support that while you transfer that person to the hospital. That kind of thing would still be a good thing to consider. But again, there are a lot of fractures where people wouldn't know that there is a fracture. Like for example, people often come to me with a small bone fracture in the wrist, which is called scaphoid fracture. तो वहाँ पर उतना पेन भी नहीं होता है, वहाँ उतना दिक्कत भी नहीं रहती है, तो people often ignore that kind of things and they come quite late to me. So yeah, in simple words, if I may say, if it is something where the pain is really bad, seek help, and at least at the nearest center. Even if they have done an x-ray and said that there is no fracture, that's fine. At least the first part is checked out. But even further to that, at least you go to the nearest center or an orthopedic surgeon, because there may be a ligament injury which is not being addressed, because a lot of people may not be having, the general physicians may not be able having the inkling of that could be there, that kind of things.
All right. So next I have something about old age and how can I have an independent and an active life in old age. To have that, what are basics that I should be doing in my 30s and 40s?
Exactly. That's what I was going to say. So to be hale and healthy in the old age, we have to start that journey from when we are 30s or 40s, not when we are 60s. Then we start doing the things. So in terms of, the main thing is about how healthy we keep ourselves. It is the whole thing. It's not just about what you eat, how you eat, how you maintain your weight, how you maintain your overall muscle quality, muscle strength. All of those things matter. So it's the rain sen ka ek reet hai, rather than just one thing to change or nothing like that. So how well we look after ourselves in our 30s and 40s, the better it gets when we are older. Because if we don't do anything in our 20s and 30s, and if we are couch potatoes, and when we are 50s or 60s suddenly jag jayenge and we want to start doing running for marathon or something else, then we may not be able to achieve those things in a better way, in a way we want to. So from that perspective, keeping ourselves healthy at the right time is all what is required.
They say best day was yesterday, the next is now.
Exactly.
Suppose somebody is watching us right now who are in their 40s or 50s. Let's say they've been couch potatoes. Is it too late, or what can they do now?
So that's what I mean. See, better late than never. So obviously you have to start, even if it is at that point. But yes, again, you're not going to straight away go and start doing high intensity HIIT kind of things on the day one. So start with the simple things. Start with some stretches. Make your muscles become more flexible. Start with whatever suits you, whichever activity, but start with literally 10 minutes, 15 minutes things, and then gradually build it over in terms of duration and intensity.
Today we see a lot of emphasis, rather a lot of attention being given to these vitamins. B12, D, all of this will also impact your bone and muscle health. So what is your observation about these?
Yes. So in terms of vitamin D, B12 are definitely required for the body, but they have become overhyped, overused kind of things, to be honest, in terms of how they get projected as if every single problem in the muscles and body is because of that. So why I'm telling this one is, see, when we do the blood test for 1,000 people, out of them 900 plus people will get vitamin D as on the lower side, and around 300 to 400 people will get vitamin B12 as being on the lower side. So the reason why that is happening is because, one, not adequate exposure to the sunshine, and even if we get exposed, the pollution and all the things may not allow us to collect enough vitamin D. That could be one reason as well. But whatever said and done, vitamin D, if it is in the lower quantities, that can lead to some amount of muscle pains or body aches and those kind of things. But
also injuries? Does it lead to injuries?
less likely, because we can't blame that for everything. And that's what I mean. See, a lot of times what happens is people would have had one muscle pain here, which is for happening for a specific reason of keyboard or whatever. And then vitamin D gets blamed for that. And the poor guy will be taking vitamin D for next 6 weeks, 8 weeks, and iska kuch nahi ho raha hai. The reason being because vitamin D, theek hai, vitamin D sahi matra mein hona zaruri hai. Take the vitamin D, take the supplements, not a wrong thing. But don't expect that to cure everything in the body. Okay, because a lot of times it gets construed as if that's going to cure all your body pains. Same thing with vitamin B12 as well. Vitamin B12 is a different thing. It's a water soluble vitamin. So body cannot absorb it in huge amounts. So some people will have inherent problems with absorption as well. Being vegetarian is one thing, which is one reason why people may have vitamin B12 being low, or even proper non-vegetarians can still have vitamin B12 being low.
How?
Because the kind of cells which are required for absorbing it in the smaller intestine may not be there in some people. So that's why their quantities will be less. So vitamin B12, if it is in the lower quantities, it can lead to some amount of tingling kind of feeling in the legs or hands. Those kind of things can happen. But again, that gets blamed for all sorts of things which are nowhere related to vitamin B12. So
Nothing.
if you do it, because every year nowadays it's a fad to get the blood test done, तो उसमें कुछ निकला कि विटामिन डी कम है, विटामिन B12 कम है, तो उसके लिए ट्रीटमेंट ले लेना गलत नहीं है, बट हर चीज़ को उसको दोषी मत ठहराना. दैट्स नॉट गोइंग टू बी द कल्प्रिट एवरीवेयर.
So जैसे कि बोलते हैं कि कुछ कुछ प्रॉब्लम्स के लिए there are few vegetables and stuff, vitamins and stuff. For your bones and tendons and ligament health, is there a friendly vitamin?
So wait, so bones again,
Calcium.
bone is calcium related. People get muddled with regarding cartilage and muscles as well, because cartilage and muscles are mainly protein based. They are not calcium doesn't do anything for them. So having a kind of balanced diet is what is the right thing to do, rather than specifically run behind specific vitamins or proteins. But if somebody has got already some amount of wear and tear or arthritis, early stages of arthritis, then some specific proteins can help. Like for example, glucosamine chondroitin sulfate का जो combination का tablets आते हैं, that kind of things can help in improving the things for the lubrication in the joint. For even collagen supplements can help. Those kind of things can help actually.
Lastly, in Karnataka, also down south, the concept of kal soup. Whenever there is a bone
Yes.
fracture or something, they
Yes.
say kal soup is good. It's basically the broth of the mutton,
Yeah.
the bone.
Yes.
So, do you vouch for it?
So it's a good thing, no doubt about that, because it does give you enough proteins and calcium. So it has got a mix of both. So that way it is a good thing to have. But इसका ये मतलब नहीं कि कोई वेजिटेरियन है उसको हम टूस के काल सूप पिलाएंगे, because see there are other ways of doing that as well. It's not like that's the only kind of mix of things which is going to work and nothing else. ऐसे तो नहीं है.
तो वेजीज के लिए होता क्या है? वेजीज के लिए करना क्या है? Instead of kal soup.
So veggies के लिए you always have, see calcium के लिए obviously milk is a very good supplement for that, and nuts also, and nuts do give you proteins.
All nuts?
Most of the nuts do have higher proteins compared to other things.
Walnut.
Of course, they will all have around 23 to 27, 28% of them will be protein in them. So nuts do give that. Milk is there. So these are, and if they are vegetarians, then eggs are there. So these are the kind of things which will still give you enough proteins and calcium, of course.
I think we have addressed most of the, what do you call it, the categorical problems. So finally, since you specialize in sports injury, any, what do you call, group advice or like tips that one can take how to avoid sports injuries first?
Okay, so see, sports injuries happen for a reason. A lot of them shouldn't be happening, to be honest, because if we take care of the things from as simple as how the ground has been laid, what kind of safety things have been there on the court or ground, whatever we are doing. So from there to how we take care of ourselves. So the part of how the court and all may not be in our control many times, but for our own safety, our own things, the important bit is know your sports before you start. Because if you are really going to take a new sport suddenly, so then know that one in and out. It doesn't necessarily mean that you have to go and kick the ball and only then you will get to know. Today you got a lot of social media things to understand what is that sport like, and whether you suit for that and whether the sport suits you or not. That make a little assessment for yourselves by watching few things, and then understand what your current condition is. Current condition in the sense whether your muscles are in a good condition for that, whether your flexibility is good enough. If not, maybe trying towards that. If that is your passion to go to that particular sports, उसके पहले खुद को ठीक बनाओ, खुद को थोड़ा बहुत. It may be something as simple as doing a bit of jogging every day first to begin with, and some stretching and all those things, and some subtle weight training kind of things. And then once you are doing that, then you go and start doing the things, no problem. And then when you start, gradual increase in the intensity, not suddenly going from 0 to 10. एक दो करके धीरे से आप ऊपर चढ़ोगे तभी you will not have injuries. So these kind of things if you follow, then at least we can prevent lot of injuries.
Lastly, for general public, I know there is a saying, apple a day keeps the doctor away. But what is the apple here to keep you away? I mean, what should they do to just take care of their general
Yes.
bone and ligaments and the muscle health?
Yes. In fact, I would rather not see these people. In the sense, if they can take care of themselves, I would be happy. So that then I can focus only on those who have
Surgeries.
grievous injuries or something more bigger things where really my help is required. So from that perspective, that's what I mean. Again, proper warm-ups and cool-downs if you follow, and proper regime where you are doing it in the right way, where you are not overburdening yourselves with too many activities suddenly and gradually increasing your intensity, then you should be not coming to me, hopefully.
ये तो sports के लिए हो गया.
Exactly.
But for all the other non-sports and the whole
Yeah.
anybody who's watching the normal category,
Absolutely.
for them,
Yeah. So, I mean, see, whatever age you are, keeping yourselves active is extremely important, because now, for example, we see kids who are in their teens. Now, so huge amount of stress gets put on them for JEE, for NEET, all sorts of exam preparations and all the stuff. So I do see, it's sad to say, but yeah, I do see quite a few significant number of students who are in their teens with back pains, neck pains and knee pains, where they're not even going and kicking a football. But because they are sitting and studying, they are on in front of their laptops, books throughout the day they are getting these things. So for any age group, bit of activity, even if it means, see, not all of us can practically get 1 hour, 2 hours. We don't have that luxury. A lot of us don't have that luxury. Even if it is for 10-15 minutes of just some stretching, just a bit of making your legs warmed up, and doing a bit of walking around, or if you are more fitter, then some amount of jogging, running kind of thing, some aerobics. So a mix of 2-3 things, even if it is 5 minutes each, would still be a good thing rather than not doing anything.
Amazing. So lastly, I read a quote, sir, which basically said, I'm a dad and an orthopedic surgeon. Nothing scares me. You're
Yes.
both.
Yeah.
So actually tell me what scares you now.
Yeah. So no, I mean, to be honest, I did get scared on that day when my son fell down from the tree. So yes, I mean, if you in metaphorically I was talking about, but yeah, coming to this point, so orthopedics is a bit more wider kind of subject where we see everything from head to toe. That's the thing. For example, if you talk about gynecologists, if you talk about ophthalmologists, they will be seeing, or ENT, they will be seeing their own specific niche areas, but we get pulled to all over body. So we see all sorts of injuries, all sorts of trauma. So for that reason, we sort of become a bit more of, okay, yeah, to chala, okay, this is what it is, kind
Nothing
of thing.
scares you.
But at the same time, yes, I mean, although we say that, but at the other end of the spectrum, the important bit is for us to understand what are the concerns patient has got, what are the fears they have got. Because see, when a patient comes to me, even to explain to me what problem they have, it may be very simple problem for me, but for them they would have rehearsed it 5-6 times before they come to me कि क्या बताऊँ डॉक्टर को, क्या चीज़ें उनको बोलना है, क्या चीज़ें मैं भूल जाऊँगा. There are people who write down the list and come as well because they worry that they may miss something. So from that perspective, although yes, for me that problem may look very simple, but for the patient in front of me, it's a huge problem, because that may be stopping them from going to the job, that may be stopping them from earning their daily bread. It may be something which has been putting a lot of strain in the family. Huge things. We wouldn't know many times because patient can't explain all of that to us, and there'll be a barrier, doctor-patient barrier. Of course, that subtle barrier will be there, how much ever we try to be on their side. But yes, if we try to understand that bit of their concerns, fears, then that will make it life a lot more easier. Not that we don't understand, but at the same time, yes, like I told you earlier on, I said that I see 80 patients. But at the same time, it is something where I have to be giving that quality time for each of those patients. Otherwise, I'll not be doing justice. Otherwise, I'll be writing down 5-6 medications for each patient, which is not going to help them anyway.
Amazing. Keep going, doctor.
Thank you.
And in the whole conversation, I did hear a couple of sentences wherein you remembered God. And I've seen this. Most of the doctors, they say there is something which is beyond our control, and that is God. So, what is that you believe in? I'm sure you believe in God.
Yes. So, I believe that there is one power which runs all of us. There is something which is there in the background, which is what, because how much ever we try to be efficient, we don't know the whole thing at all. We are still in a very nascent stage of understanding the process. If we are talking about how the body works, it's a miracle. How the body works is a miracle. There is no way a person can say that I know each and everything, how his body behaves or how the things work. There are 50 lakh crore cells in the body. 50 lakh crore cells in the body. Okay. And how all of these function, there must be something.
So there even beyond a doctor's understanding.
Yeah, there are things which even I don't understand. I don't try to claim that I know everything, but whatever little bit I know, maybe that can help somebody at least to make sure that the things are done in a better way than what would have been otherwise. So I try my little bit of help for them. That's all I do. Not that I am trying to be God. I can never be God. I can only try to, because for patients I do tell them, a lot of people believe that I heal the bones. I tell them that I don't heal the bones. The magic is done by your body. I only keep your bones in the right place. Your body has to do it. I can only keep it in the right place. So that kind of miracles, the body which itself it is. So yeah, it may be very easy to learn a supercomputer as to how it works, but learning how the body system works is honestly next level of thing.
It's amazing catching up with you.
Thank you.
Thanks for making this time to be with us,
Thank
to
you.
share your knowledge and to empower us more to have a better quality of life through your observations and learnings. And what are your hobbies like? Because you see a lot of people's hobby coming to you as problems.
Yes.
Being a sports injury
Yes.
specialist, what sport are you into, or what are your hobbies like?
So I used to do calisthenics, and I used to do a martial art called jiu-jitsu. So when I was in UK, I had trained through quite a advanced level tak. But yeah, once I came back to India, sort of things took a bit of backstage, because obviously the kind of setup, getting the things ready and all those, the work because there the work culture is very different in UK. Once you are out of the hospital, you can literally switch off your mobile, nobody will bother you. But here it's a different thing altogether. So from that perspective, it was a bit difficult in the initial years, but now I still go for a little run in the evenings once I get a bit of time. So that is one thing which I do.
Where
I
do you
play chess
stay,
with my
doctor?
son in Kormangla.
Oh, okay.
Yeah.
So you have your
Yes.
clinic in HSR layout, and you
Yes.
go to Manipal, Sarjapur.
Yes. Within 3 kilometers radius. I don't want to travel more in Bangalore. So yeah, it's all close to each other.
What
Yes.
next?
Today, yes, I need to go for rounds now. I need to go around and just see the patients. The child whom I operated this morning, and there's one more patient from yesterday whom I have to see, and then wind up my day.
In life, what next?
In life, don't know. Initially I had talked about and dreamt of opening hospital and all those things, but as the things are going on, I'm happy with what I'm doing. I'm doing some quality work for my patients and all those things. That's all I'm happy about. My children decided not to come to medical. So both of them don't want to. So that made my life easier. I didn't inspire them enough perhaps, but that made my life easier.
No, not
Yeah.
really.
Yeah, no, but because they chose other, we didn't force them to come to medical or anything. So they chose other professions. So we are happy. Yeah. Whatever next 10, 15, 20 years, whatever I can keep going, I'll keep going, and then hang my moods.
What are the books that has touched you?
So Charles Dickens I used to read a lot when I was in UK. Now, yes, I don't get that much time, unfortunately, yes.
Any books, suggestions for people who are starters, like wanting to read?
So regarding the sports injuries, There are quite a few books which are coming up actually. In fact, we are bringing up a book in the next couple of months.
Oh, yeah.
Yes,
What is
because
it called?
these are the same things. We have not named it yet,
Uh-huh.
but it's just we are just completing the last bit of that one, and this for the same reason like what we talked about, my experiences for last 6-7 years. That's what I try to wind up and make it as a kind of thing. So probably a lot of it we discussed just now, and a bit more maybe in the book. That's all it is.
Amazing.
Yes.
Keep going, doctor. And
Thank
here
you.
I have a book for you.
Oh, thank you.
It is Notes on Startups and How to Build the Future, 0 to 1.
Very nice. Very
You
nice.
just mentioned that, you wanted to have a hospital of your own. I don't know what this book can do to your thoughts.
Thank
It
you.
can be a seed, or it can be anything. I mean, happy reading. So while I sign this for you,
Very nice.
could you please nominate 3 guests for us who should
Yeah.
be on Just Curious from any walks of life? Like,
Okay. So one could be Pranesh. Do you know there is one? He's from North Karnataka.
he's a comedian.
Comedian. Yeah, stand-up comedian. He is a wealth of resource. I mean, he's not just comedian. He talks a lot about the kind of there's a message in that. Every time when he talks or when he gives there's a kind of message in that as well. Very, very interesting guy to communicate with. He may be one person I can say.
Mm-hmm.
Second one may be one guy from Mysore. His name is Shushrut Gowda. He was my classmate during MBBS, and post that he went to US and he did his neurology, all the qualifications and everything. He was a consultant neurologist over there, director of the institute in US, and then he decided to come back to Mysore, and he has got a huge center called Neurozone in Mysore, and very dynamic guy. Yeah, and he comes from a family, Shantaveri Gopal Gowda Hospital, but very dynamic guy. And he decided recently to join politics, and he went for Padayatra with Rahul Gandhi as well, from Kashmir to Kanyakumari to Kashmir, and now he has moved on to BJP. He's very dynamic guy, very resourceful person. He has seen a lot of world, so he may be a good person I can
Amazing
consider.
suggestion. Definitely we'll get them on board. And any more
Yeah.
suggestions?
And third one may be the girl I talked about, Anita Singhan. She has had her own battles with weight and all the other things, but she has done amazing things. National level, she has got huge number of trophies and things for weight training, for the weightlifting, powerlifting, and she has won world amateur powerlifting competition.
Amazing.
So she has got a lot of experience to share, I believe.
Amazing suggestion. So Anita, who's a powerlifter,
Yes.
Sushrut Gowda, who's a
He's a
neurosurgeon, and a
come
politician,
yes.
and Pranesh,
Pranesh,
sir,
yes.
he's a elderly person who's
Gangavati
a
Pranesh, I think. Yeah, something like
stand-up
that. Yes.
comedian and
Yes.
philosopher, thinker, and
Yes.
a lot of things. Amazing.
Thank you.
So I usually write a note. So I don't know what to
Please.
write. 1 second.
Please,
sir.
awesome. Yeah. Yeah. By the way, in addition to these three, I can come again as well if you want me to.
Of course. Next, I think we should do a Kannada podcast, because
Exactly.
here you are with
Yeah.
our Just Curious English.
Yeah.
And for audience, Just Curious started as a Kannada podcast. And we both are Kannadigas, and definitely some
Kandita.
interactions will be very genuine.
Yes. ಖಂಡಿತ ಶುದ್ಧ ಕನ್ನಡ ಅಪ್ಪಡೆ ಕನ್ನಡದಲ್ಲಿ ಮಾಡೋಣ.
Kandita, sir. But today, it's nice, we are in a city like Bangalore, which is literally has blurred the lines. Like whole of India is in Bangalore today, and here
Absolutely.
we are sitting and creating
Absolutely.
content for whole
Yes.
of India, probably
Yes.
rest of the world.
Yes.
So-
And you wouldn't believe 90% of my patients are from all over India.
Oh,
Andhrites around 4-5%. Couple of percent from Tamil Nadu. 1% from Malayalis. 1% Kannadigas.
oh,
So literally I see 1% of out of 80, usually it would be one consultation will be in Kannada.
oh.
So
Out of 80, I mean, that's Bangalore today, and
exactly,
that's
yeah,
the
it's a
kind
very
of area also
cosmopolitan
you're-
kind of
you're
area.
living.
So in a day I would have switched between 6 or 7 languages without me even realizing that I have spoken in all these languages.
You're a wizard doing that, I'm sure. So I don't know what to write, but I tried something. Dear Naveen,
Thank
sir, wishing you a lot of eureka moments and peace. as bones and problems will anyways come in search of you. Until next time, keep
Thank you.
healing.
Thank you very much.
Just
It was pleasure.
curious.
Thank you.
There you go, sir.
Thank you very much.
This episode's dessert partner is Polar Bear. Polar Bear, the ice cream sundae zone. Polar Bear is now present in 160 outlets, 30 cities, and in 5 states. If you're a vegetarian, that too 100% vegetarian, Polar Bear is for you. The menu has 40 plus ice cream sundaes, and all the ice creams are made from pure milk. What are you waiting for? Visit and keep sharing the Sunday love. So that was today's Just Curious. I believe we've explored enough about how our body functions, keeping the lens of bones, the muscles, the latest surgeries that is out in the market, how to take care of our body, vitamins, and a lot more. So do let us know in the comment section as to what part of our conversation did add value to your life, to your lifestyle, and also do recommend your guest suggestions. Until next time, this is your Rapid Rashmi. By the way, Rapid is a title given to me as a Kannada RJ. My Kannada is really rapid, very
English
quick.
is fast as well.
So that's
English is rapid as well. Isn't it? Yes.
So yeah, I've just tried my best. I think this is my infant stage into being a Hindi and English content creator. There's always a first time, and here I thoroughly enjoyed conversing with you, sir.
Same here.
Until next time, take care and thank you.
Thank you.
And I'm going to see you next, not as a podcaster, but as your patient.
Sure, of course.
I have my PRP, which has to be done.
Thank you.
That day, I think I should keep a camera and show them what happened and how I reacted, because my husband Davis has literally scared the shit out of me because it's like very painful for the first minute. So that's what is
Yeah.
keeping me
Away from that.
holding me back. But I need to cross the line, and I will. Thank you, doctor.
Thank you.
Thank you so
Namaste.
much.
Thank you.